for this week's presentation. Then next week, we are going to have the slides as well, just like that. So one thing I can assure you of 100%, in fact, 101%, is that you will get the slides and you will get the recording. So never mind, you will get everything. That is what we are good at doing. MJB management, we ensure that like those that just are already, we have a couple of people that are in the caregiving, taking the professional diploma in caregiving, as well as here in the CNA, so they can attest to that. We make sure that we give them the slides as well as the recording, so you won't miss anything, Madam Patience. Be rest assured. I don't know if you heard me. Madam Patience, are we still together? Did you hear me?
Yes, so I've been giving thumbs up, sharing my love, and throwing you flowers. My reaction. Thank you.
Thank you. All right. So, practically, without wasting time, let's just really go to how it's going to be. I would like to crave your indulgence to plead with you to please ensure that you mute your mics, because we are just going to be moving. Because network, as you said, well, we don't pray that it shouldn't be friendly. We just hope it will be okay for everyone. So we will just see how best we can get this thing done. So please, to help us, so we can help ourselves, let's adhere to the rules. Please just mute your mics. If you have any questions, please ask, or you put it in the chat box. What I do occasionally is I go through the chat box and I try to answer questions as I see them. Now, again, this training is going to be, it comprises of the theoretical aspect as well as the practicals. Like I told you, CNA course has got to do with the practicals more than the theory, because it deals with the practicals. And also, as I already said, we have a way of making sure that you learn all the skills that you need to learn. You would not miss anyone, so that you'll be able to stand the test of time and be able to fit into any setting you find yourself. So that's just it. So we are going to look at the first 2 days. We are going to take the first 2 or 3 days for the theory, because theory is important. So some of those things I'm going to be talking theoretically, I'm also going to be showing you the practical aspects of them. So when we go through the theory, it's just for you to have something to read, maybe to follow up, to back up. But the practical is where we are really going to delve into, because we intend to explore the dissect CNA. Just make sure that you are fit to stand anywhere, any country you want to, you may wish to go to. So that's practically what we are going to do. So today we are going to look at the first 4 modules. That's what we are going to look at today. Introduction to healthcare, I think ethics and professionalism. Yeah, anatomy and physiology, infection control. Those are the 4 things we are going to look at within this time frame. So before I continue, I'd like to hear from Mr. Isaac. Mr. Isaac, I can see your hand is raised. Do you have any question? I like to carry people along, so I pause intermittently anytime. I don't want us to be bottled up. This is actually not a lecture. It's an interactive session, because nobody's an embodiment of knowledge. So I want to learn, as I have been learning over the years from participants. I want to learn from you as well as you are going to learn from me. So we are just going to have an informal setting, not the normal characteristic setting of a training. You know, we are just going to explore and interact, because we are dealing with human life here. So Mr. Isaac, I saw your hand raised. Did you have any question to ask? Mr. Isaac. Okay. Perhaps he's not ready. I saw your hand raised. Okay. So let's quickly delve into what we have. Obviously, we want to look at our first module for this evening, which is Introduction to Healthcare. Okay, Mr. Isaac, I was asking. Yes, go ahead, sir.
Yes, good evening. How are you doing?
I'm good. Thank you, Mr. Isaac. I'm good. And you?
All right. First of all, I want to say a very big thank you for this great opportunity. As you can see, I'm communicating from Monrovia, Liberia. But
wow.
I'm having an issue here. The issue here is the network system. I don't know if there is something can be done to scrutinize the network properly for some of us here, because it's getting bad over here. I don't know whether it's my end or your end, because you are breaking in.
Okay, I'd need to find that out from the participant. Thank you first and foremost for that observation or for what you've just said. I'd like to find out, because I need to carry everyone along. I'd like to find out, please, can everyone hear me loud and clear? Please, I need a response.
Very loud and clear.
Yes, ma'am, we can hear you.
Okay, so I'm thinking, Mr. Isaac, I'm thinking it's because you are far away, you know, Liberia is a little bit, and maybe the conditions there for now. But what I can assure you, it's not from my end. I have done everything.
Yes, we can.
Okay, to ensure we have a hitch-free session. But let's just see, maybe you can switch your network or you can off and on again. But the ultimate thing is that never mind any part of it you miss. You certainly get it, because the recorded version and the slides will be given to you. So you can just fill up the lapses that you could not hear me. So I don't know if that will be fine for now, Mr. Isaac.
All right, ma'am. All right, ma'am. I think I'm getting you clearly now. It's getting better.
Okay, thank God. It's surely going to get better. Thank you. So after answering that, let's quickly delve into.
Sorry to interrupt you. I put it on chat. Could you use the slideshow so that it's more visible?
Yeah. Thank you. I'm going to do that. I'm going to do that. I was getting to do that. Thank you for reminding me anyway. So yes. So let's move into what we have. Good. We want to talk about. We are looking at healthcare. Like before I went into healthcare, into the health sector, people that have had trainings with me over the years know that I like to share my experiences. I like to tell a lot of stories, maybe because I've taught for many years. And so I just like to teach. I don't like to train, I like to teach. So bear with me, any method I give, just let's move together. So before I actually went into this health setting, like health sector, I wasn't very passionate about the health sector. Like I told you earlier, I was a teacher and teaching, you know, fun with children. I love to be around children and all that. But something inspired me. I had an inspiration. Something inspired me to go into the teaching. So as I was saying, I actually had the passion for this when something happened. You know, I have a father, like I told those that when I was a military man. You know how military people can be. Very filled with, always in charge, always in command, you know, in charge of the situation. And no dull moment of having a prostate cancer. At that time, I got to see certain things. I got to watch my father that I've known very agile all through his life, you know, all of a sudden just go down and became, you know, I don't know, he just became sick and he would lie down and he would just turn to something else. You know, I watched him pass through a whole lot, being in the hospital, you understand, and going through all these things. So I watched him day by day because I was with him, you know, all through. And I felt something in me just shifted. There was a paradigm shift in my mentality, because I began to see that the way a caregiver, the way a nurse, the way a loved one attends to a person when the person is not well, when the person is having one illness or the other, goes a long way in helping that person get better. That was the very first time I had to think about this healthcare thing. I was like, oh, I looked at my father, I saw how he was, but because of the love and the care, you know, we gave to him, the nurses around, the midwife, the CNAs, the nurses, the doctors, all the members of the health team, I saw the way they took time to really look after him. And I saw that because of that care, because of that connection, because of that bonding, it helped my father to recuperate faster than we even thought. And at the end of the day, he was actually better. So when I saw this, it showed me something. It just clicked in my head. It just told me something that, wow, someone can really get better with the help that you render to the person. So as healthcare practitioners, before you even attempt to go into being a CNA, like I want to say, first and foremost, make up your mind. Make up your mind that you are going to do this task. Whatever you don't have the passion to do in this life, believe you me, you would not do it to the best of your ability. So the first thing starts with the passion. I don't know why, I don't know the reasons that we may have to actually want to go to become certified nurse assistants. We may have our different reasons, maybe love for humanity, maybe to take care of the sick, maybe to help the suffering. People have different reasons why they actually go into different professions, So before, I want to prepare your minds before we even move into the slides that becoming a CNA is something that you have to have the passion to do. It's something that you have to tell yourself, yes, I have to play a role in serving humanity. I have to play a role in making the wounded, the suffering, to help alleviate their suffering. I have to play a role because I am very particular about human life. I want to play this role because human life is very important and there is nothing as important as life. So all these things put together should be at the back of your minds for you even attempting to take the CNA program, or maybe you are a certified nurse assistant or a caregiver, because of course you are a caregiver by extension. You are a caregiver. Anybody that renders care is a caregiver. So these are things I want us to understand. Don't just go into it because you want to be maybe for greener pastures. Like we said, the country is very tough and so on and so forth. I just want to move. I just want to go somewhere, where I can get better and where the grasses are greener. But I tell you that with passion, you can actually achieve it. But without passion, you would be in the wrong profession. So first and foremost, it is important that you prepare your minds towards what lies ahead of you. And I want to also remind you that being a CNA is not a walk in the park. It's not a walk in the park at all. It's not a rosy thing, because you would have to deal with people that have different illnesses, people that are vulnerable, people that are sick. And so you have to show them certain characteristics to help them to do better. So needless to talk too much, I like to talk much. I like talk much. So forgive me when I talk too much. I like to, so that you understand where I am coming from. I'm very passionate about these things when it comes to human life. So now, what is this health? It's just about people's physical and mental well-being. That's the thing. It involves a wide range of professionals, not only you. You are a member of a team. As a CNA, you are a member of a care team where you have doctors, where you have nurses, where you have a physiotherapist, you have other practitioners in that particular field. So you are a member of the team. And just as a chain is, if one is of that chain, well, that is how a care team is. So all the members, all the different ways to ensure that that chain can actually stay as it is. So the healthcare system is to provide that they are born through adulthood, hospitals, clinics, rehabilitation centers, long-term care facilities, and so on. We have different healthcare facilities that we already know. So we are going to look at all these things. So practically, the healthcare system is very broad. It depends on which one, the primary healthcare, the secondary, the tertiary, and so on and so forth. So as certified nurse assistants, you play a very vital part in the healthcare team. That's what I want you to understand. Okay, so let's see, like I like to say, and I'll still remind you at any point, every clear audio, okay? Use the slideshow for better visibility. Okay, just as I said, from time to time, I go through this, the chat box. So let's move to the next slide for this evening. Okay, importance of healthcare. What is the importance? Importance of health care. Healthcare is very important. Of course, we said that health is wealth. A healthy body is a wealthy body. A healthy person is a wealthy person because you still have hope, even if you don't have. Because you are healthy, you know that there is hope. So health is very, very important because healthcare promotes the physical and mental well-being of every individual. It helps you to manage chronic conditions. It gives you improves your overall quality of life and your social health. So that's practically the importance of healthcare, like we already know. So as healthcare practitioners, as certified nurse assistants that we would eventually become the soonest, we need to understand that everybody's health is important. Your health is important, even as a CNA. It's not all about your clients. It's not all about the patients. The health we are going to be looking at is vice versa. It's going to be on the side of the CNA as well as on the side of the patient. So it is important that we take note of this thing. So that's the importance of healthcare. Now, let us look at this healthcare. We have different, okay. All right, so we have different types of healthcare, like sections of healthcare. We have the primary healthcare, which is the first point. Primary healthcare is the first point of contact for most people when they have a health plan or they need medical attention. If your child is not fine, or maybe your husband or someone you know is not fine, the first point of call will be reach out to the hospital, and there you get to see a general practitioner that will take care of you, or maybe nurses, maybe dentists. That is the primary care setting. Maybe you visit a family doctor or general practitioner, and in primary care setting, healthcare setting, it's care of common illnesses and minor injuries, routine screenings, and maybe vaccinations too. That's the minor one. I have fever, I want to see my doctor. That is primary healthcare. It's important we understand this thing. Now, we have the secondary healthcare as well. The secondary healthcare that we can see here refers to more specialized medical services, more specialized. We deal with specialists, maybe neurologists, maybe oncologists, maybe pediatricians, and the people that are specialized in their own field. So if there is a challenge that needs a field of expertise, you would be referred to move to the secondary healthcare system. That way, you'll be able to get a person that is specialized in that particular field that is related to that particular illness. So having a medical procedure too, done like surgery, so the major thing for you to understand is the primary one is just the first stage of care, where you just have maybe little illnesses here and there, things that could be handled in a smaller setting. That is the primary care. The secondary involves maybe where you have to visit specialists, maybe cardiologists for one thing or the other, or maybe gynecologists for women that have challenges and maybe have an X-ray done. That's the secondary care. And we have the tertiary care as well. We have the tertiary care, which is
Now we cannot hear you. Your voice is
hospitalized patients and those undergoing operations. Now, tertiary care is the most advanced.
Sorry, ma, we can't hear you. We can't hear
I want
you
you
at
to
all.
understand
Now we
the
can't hear
difference. It's the
you.
most advanced and specialized type of medical care, severe health issues. Like when my father earlier on, is it from my end? Okay, let's find out. I was saying, can we hear me now? Am I legible enough?
Yeah, you are legible. Can hear you now.
Okay, please. I think network is the challenge over there because I'm trying to really talk out so that I can be loud enough. I was saying that there are 3 types of health care. The primary care, the secondary care, and the tertiary care. Please, are we together? Can everyone hear me? Very well.
Yes, we can hear you now.
Okay. So I was saying that the first point of care is the primary care, where we go when we have maybe minor illnesses. We have just little, maybe a headache or a fever, or we just need a little medical. We want to see the general practitioner, let me say so. So that is the primary care. Then we have the secondary care too. In the primary care, that's where we have the nurses, we have the dentists, we have the certified nurse assistants, as we are going to be. That is where the primary care, that's where their duties are really centered around. Then we have the secondary care, which involves a bit advanced medical service. Maybe you want to see a gynecologist, maybe for a woman that has issues, and then maybe with her womb or something, you'll be advised to see a gynecologist. That is a secondary care system, healthcare system. You have to see a gynecologist because a gynecologist is a specialist that will attend to you, that understands everything that has got to do with the female anatomy and when it comes to the womb. So we also have, and there you get to see oncologists, you get to see people that are specialized in their own field of endeavor. Okay, then we also have, when you want to have a surgery, you'll be recommended, referred to go to the secondary care. So we also have the is the most advanced, medical care. And it is with it's the most complex and severe health issues, those that actually have severe health issues, like that prostate cancer I told you about, and they need a fibroid or one or two surgeries to the issue or to get the issue sorted out. So these are the different types of care that we have. Then in a summary, like I like to teach, I like to make my teaching to be well explanatory. I like to come down to the level of everyone so that we would be able to understand. Everybody can understand. All of us can be on the same page. So sometimes I get to do like that. So summarily, these three types of healthcare, how do you distinguish? The primary healthcare is basic. Is the basic one, the everyday thing, the everyday healthcare. I have a headache, I have a fever, I have malaria. That is the primary health. And the second care is more specialized. It's a more specialized treatment, while the tertiary care is the most advanced, complex medical services. So it is important that we know the difference between the three as healthcare practitioners, because as certified nurse assistants, we are healthcare practitioners. So it is important we know the difference between these three health care. So now we want to look at the role of a certified nurse assistant. What is your role? What are you expected to do? What role are you expected to play in a healthcare setting? This is very, very important. Yes, we're supposed to be 33, and like I said, attendance is mandatory, and attendance is very, very important. So I am going to check as time progresses. We are 26 for now. Others are yet to join us. All right, so the role of a certified nurse assistant in healthcare. What role does a certified nurse assistant play in healthcare? Like some of you asked me sometime, those of you that I had to talk with, that I had an interface with, try to ask me some questions. Sometimes I took my time to explain to them. That's why I prefer people, when you have any hitches or any bottlenecks, I prefer you relate with me directly, and so I can do a lot of explanations to you. Now, as a healthcare assistant, you are not permitted at any time to do certain duties. You are not. You have your scope. You have your job specifications. So you are not expected to do certain duties. And it is important that you know the duties that you are not expected to do so that you don't breach your ethical gap. You don't breach that gap. Now, as certified and nurse assistants, like we can see here on the screen, I need to know, please, can everybody see my screen clearly? Because when there are network fluctuations, there's a way the screen just goes off.
Yes, I can
Yes, ma, we
see.
can see your screen.
Yes.
Thank you. So for, intermittently, I'm going to be asking you because I like to carry everybody along. There is nothing I hate like at the end of a training, someone said, I was not able to get you. I was not able to, I don't like that. I don't like, so I like to make sure that everybody, you paid for this service and you have to be given value for your money. And we want you to actually excel. So please, if you have any challenge, I am on the chat box. I'm going to just be looking at it as I go through. So certified nurse assistants play a crucial role in the healthcare team. They assist patients with activities of daily living, such as birthing, dressing, and feeding. Now, as a certified nurse assistant, you are, let me say, I don't know how to put it, you are about the closest to the patient. What do I mean the closest? They interface with you first before they get to the nurse. That's, you are like closer to them. So they easily can reach out to you when they have any challenge. In fact, they prefer reaching out to you than even the nurse because you have that closeness with them. You are always there with them and they feel you are reachable. So as a certified nurse assistant, part of your duty or one of your duties is you in the healthcare system is you attend to the activities of daily living. The things we do daily, like maybe bathing, assisting a client to take bath, assisting a client, a patient to dress, maybe a patient that cannot actually dress himself or herself, and then feeding. Do not forget that these people are people that actually have challenges. They are ill. They are ill. So they are vulnerable. Ordinarily, they wouldn't have wanted help from anyone to do these things for them. I want us to understand. There are things I'm going to really be stressing as I progress in this training over the days. I'm going to be stressing them because there are things that are important. So when I keep stressing something, understand that it is important. I'm trying to lay emphasis. Now, we are going to have to be relating with these people, relating with these vulnerable people, relating with them, maybe bathing them, maybe brushing their teeth, maybe dressing them up, at times feeding them, mobility too, taking them around. Those are most of the, that's one of the major things, duties of a certified nurse assistant. Now, monitoring too and reporting changes in the patient's condition. This is another thing that is our duty. As a certified nurse assistant, you are there with the patient. So you monitor, you look out, you are observant, you are sensitive to changes, you observe. For instance, if a patient is just given medication, maybe a patient is just given injection, you are expected to monitor, to see the reaction of that patient, to see if there's any sign, anything that it's out of the ordinary, that you can really see, that you can see. Don't forget that the nurse will just do what he or she has to do and off maybe going to, you are the one with the patient, you oversee, you move, they can ring the bell for you, they want this, I want to use this, I want to go here, I want to do this. So you are closest to them. And as such, because you are closest to them, you get to have firsthand information concerning what is obtainable. Okay, still now, this is 5:30. Please, can everyone hear me? Because Mr. Chinonso, you are saying my voice is breaking. Please, is my voice breaking? Can everybody hear me?
Yeah, you like that.
Okay. So that's just one person. I think that voice of that's the voice of Queen Madweke, if I'm not mistaken. I need to hear everybody, please. Can everybody hear me? Okay, please. I'd need response so that.
Yes, I can hear you, ma. Yes, I can hear you. I can hear you.
Thank you. So when I hear unanimous response, I know everybody is going with me because it's a particular illness. Do you know that illness? There is a particular illness that I don't want to have. And that is for me to realize that I have been talking to myself. That's a very big illness. And I don't always like it. Sometimes when I have trainings, I have to keep asking if we are together. so that I would know that we are together, because it's an illness when you talk to yourself for a long time and you don't even realize you've been talking to yourself. So please, intermittently, I would need the response. Thank you so much. So as I was saying, it's also our duty to provide comfort and emotional support to patients and their families. This part is very, very important. As a certified nurse assistant, be empathetic. Empathy is very important. Have humanity in view. Walk a mile into the shoes of your patient. Understand how they feel. You cannot be a nurse if you don't feel the pains of others. You cannot be a certified nurse assistant if you cannot understand how, if you cannot be empathetic towards another person. So there are certain characteristics that are actually needed in this job. That's why I started by saying that don't just jump into it because maybe you just need the certification, you want greener pastures, and that. No, do it with passion, because if you are passionate about it, you will understand. Take, for instance, that you have a father or you have a mother that is in the hospital. You understand what kind of treatment, what kind of attention, what kind of care would you like that person to be given? That would answer the question. So you try to see how best you can attend to your clients, feel their pains, encourage them, comfort them, give them that emotional support, and extend to their families as well. This is one of the things that you need to do. Like I always tell people, like I said in the caregiving platform, when I had the caregiving training, I told them that for you to be a caregiver, like a CNA is a caregiver, you have to do away with some characters that you have. If you are a temperamental person, then this profession is not for you. If you are someone that you don't have feelings, you cannot empathize with another person, please, this profession is not for you. So there are certain, if you are a person that is not patient, you are not understanding, this profession is not certainly for you, because you would be doing a very wrong thing, because it's not going to be a walk in the park. You are going to find people that are difficult. You are going to have people that will misbehave as a result of the illness. It is not about them. It is about the illness. You understand? And when we get to anatomy and physiology, you would see how those illnesses affect people, affect them. So when they behave, sometimes you look beyond their behavior, look at the illness, understand that it is the illness that has made them to behave the way they are behaving. And as such, it is easier for you to be able to handle them. So they need that comfort, they need that emotional support to them and their families. So as a certified nurse assistant, you have to walk a mile. You have to spread your tentacles to also embrace the families as well. Please, you can ask your questions at any time. I'm open to questions. I'm open to contributions, because I know there are people that may know more than me on this platform, so you can also help. So maintaining a clean environment and safe environments for patients too is also very important for CNAs. Your environment you maintain, you ensure that the environment that your patient is clean at all times. You ensure that it is tidy, it is free of infection. You don't have water spilled over without you attending to. You don't have things lying carelessly. You do your job judiciously. Ensure that it is a safe environment for your patients. Also help to ensure that patients receive high quality, compassionate care. I've already talked about that. Be compassionate towards them. Understand how they feel. Maybe a patient is going through pains. Yes, you are not the one going through these pains, but you can, I understand how you feel. Just that, we understand these things. Just sometimes, just a word from someone can go a long way, in minus the fact that we are even looking at the setting. In our lives, there are times we just need someone to tell us it's fine, it's just going to be fine. And just that helps to add a little bit of hope to us, when we are passing through challenges. So are these people. You have on your patients. Point, overemphasize the impact as a certified nurse assistant or as a healthcare practitioner. You cannot understand the effect that you have on your patients. Just a little love, just that connection just that compassionate care alone can make a person to live longer. For instance, let me give you an example. Like I like to give examples in between my trainings. Thank you, Mr. Okwanku. Very clear. Thank you. So I like to give illustrations. Sometimes when we are handling these people, when we are handling families, maybe elderly people, now, do you know that especially when it comes to people that are ill and people that are elderly, that need care, the way the caregiver attends to them, the way you connect with your patients, the way you bond with them, the way you show them that you really understand how they are feeling would go a very long way in helping them to recuperate. It's just like you having parents that you look after. Maybe you care for them intermittently. You want to know how they are. You want to know if they are eating. You check up on them. And a parent that has children that don't care about them, which one do you think will have a negative or an adverse effect on them, or will increase their lives or shorten their lives? That's the same scenario. So you are overall, you are serving as a vital link between the patient and the healthcare team, like I already talked about. So as such, you should do everything possible to ensure that you play your role in a way that would make your clients, your patients per se, to get better and recuperate faster. So I don't know if so far you have understood what I have said. I like to ask intermittently so that I will know that everyone is on the same page. Please, are we together? Does everyone understand? Do we have any question at this point or any contribution before we proceed? Like I said before we started, please feel free to contribute. This is not a formal setting. Oh no, my trainings are not formal settings. This is not a formal setting. You are free to share your experiences. Like we had the caregiving training people, we had people that really talked, they shared their experiences. They told us, someone even talked about taking care of the mother and, you know, the things she didn't do when she was taking care of the mother. She was just learning it now, and this and that. They shared. There are some that have been caregivers and they express themselves. So likewise, I like to have a forum where people really talk, where we really discuss. It's not a formal thing per se. We'll really discuss and share our minds. And at any point, we are free to pause and share anything that you would like to share. So do we have any questions so far, please? I kindly need response, please. Do we have any questions? Or any contributions, do we? Wow. No one is ready to. No one is even talking to me. It's sad if no one is talking.
Hello, I have a question to ask.
Okay. Please, who has the question? Please kindly, when you ask a question, just let us know.
It's
Your
Joy.
name, please. Okay, Joy. Thank you, Joy. Go ahead.
This certified nursing assistant duties and everything that you've been saying so far, will you still differentiate will you still give us like strong points to show that certified nursing assistant is different from a caregiver? Because everything that I've been learning so far is very similar to caregiving work.
Okay, all right. Thank you so much. Thank you. Now, thank you, Joy, for that question. First and foremost, I want to tell you that they are actually different. A caregiver and a certified nurse assistant, they are both caregivers. A CNA is also a caregiver and a caregiver too. So, but the only difference is this. I want to highlight the differences. The difference is when it comes to caregiving, you have a broader spectrum, What do I mean by a broader spectrum? As a caregiver, your duties are not only confined around the medical setting. They are not confined around the medical setting. That is to say, for example, as a caregiver, you can maybe work in a private home where you attend to someone, an elderly person, and you can shop for the person. You can get in touch with the person's family. You can do you can wash, you can do a lot of things, including maybe house chores, and cook for the person, depending on your service plan or on your care plan. So, but as a certified nurse assistant, most of your duties are centered around the hospital setting, centered around the medical setting. Another difference is that certified nurse assistants don't work on their own. Like I said, when I started, they don't work on their own. They work strictly under the supervision of a registered nurse, as of an RN. They don't, that is, what am I trying to say? They are not on their own. They get instructions from the RN, from the registered nurse, and they are supervised. They cannot take any decision on their own. But a caregiver, in most cases, works with the healthcare team, the doctors, the nurses, but they have a broader spectrum. They do a whole lot of things. They can work in residential settings. They can work in the hospitals. They can work even on adult care homes, or even one-on-one caregivers, you understand. But the CNA mostly to an extent, 3/4 of it.
Please, I have a question. Please, I have a question concerning this CNA and caregiver. I have a question.
Please,
Please,
all
I'm
right.
lost, so I can't hear you from my end.
Hold on. Please just hold on. We had network challenge. I'm trying to share my screen again. All right, I think we are good. Okay. Please, can we see my screen?
Yes, you can.
Yes.
Okay, sorry for that. I think I got lost. I got lost at a point. So I don't know. First and foremost, Joy. Hello, Joy. Are you there?
Yes, ma.
Okay. I don't know if I've been able to explain to you the difference between the two.
Yes, thank you.
Okay, so that is practically the difference. You can use, the two are actually healthcare certifications. So whichever case that arises, you can use any of the two.
Please, I did not hear what you explained about a caregiver. I did not hear it because immediately you started explaining it, the network was very disturbing. I did not hear. Please, can you explain it again?
Okay. Who wants my explanation this time? Is it Joy or another person?
No, it's Charity. It's Charity. I want to understand the role of a caregiver and
I just
a
wanted
CNA.
to know the name. Okay.
Margaret is not here. There is the same thing with me.
I was saying that, okay, I was saying this. This is what I was trying to say. I was saying that there are two different, how do I put it? There are two different caregiving certifications. A caregiver and a certified nurse assistant, they are two different, even though they are all health qualifications, they are all health certifications. Now, I want to talk about a certified nurse assistant. I want you to pay attention. A certified nurse assistant works primarily, majorly, that's not to say you cannot work in another place, but primarily and majorly in a hospital setting, a residential setting, a hospital setting. And you work directly under the supervision of a registered nurse. You cannot do anything on your own. You work under supervision of a registered nurse. That is one of the differences. Secondly, the duties of a certified nurse assistant mostly is centered around the medical aspect of it. Mostly is centered around the medical aspect of it in the hospital, where maybe you have to maybe view when an injection is given, you take vital signs when a patient comes into the hospital, you check the weight, you check the height, and you do the normal things that you need to do, at least when someone walks into the hospital. And then that is majorly your duty. It's more surrounding around the hospital setting, like the medical aspect. But a caregiver, and another thing I forgot to say is, when you have the certification of a certified nurse assistant, it is easier for you if you want to continue to ascend in the nursing hierarchy. That's one very important point. You want to maybe continue from being a certified nurse assistant to being a nurse, to being a registered nurse or a licensed practicing nurse. It is easier, it is better. You start first as a certified nurse assistant and then grow in the ranks in the nursing hierarchy. That is one difference. But for a caregiver is a person that takes care of, that renders care to maybe a sick, vulnerable person. Now, for a caregiver, you have a broader spectrum. What I mean by broader, especially for those of us that want to travel out, maybe want to go and want to work in the healthcare setting. As a caregiver, you have a broader spectrum. That's to say that you are not only confined to the hospital, you can work in assisted facilities. You can work even as in the houses of people as a caregiver, maybe a personal caregiver, and your duties extend to maybe cooking, maybe washing, maybe shopping for your clients, doing all these other duties that are not supposed to be performed by a certified nurse assistant. A certified nurse assistant, your duties does not include you maybe cooking, maybe you finding shopping for your clients, maybe going extremely out of the medical setting. It doesn't. But a caregiver, you have a broader spectrum. You do a whole lot of other duties that are outside the medical setting. So like maybe helping your clients to don the shoes, maybe we are in the house wearing the shoes, dressing up, taking to bath. Yes, the duties are similar, but the only major difference is that as a caregiver, you cannot ascend in the nursing hierarchy without you having at least a relevant certification or qualification. But as a certified nurse assistant, if you can easily rise in the hierarchy to becoming a registered nurse or going further. So these are two different things. As we progress, we are going to see, Joy, I know why you are asking, because you were also in the caregiving training too, I guess. Am I right, Joy?
Yes, ma'am.
That's why you are asking this question. Immediately you asked, my mind just went. I know.
Hello.
You paid for both trains.
Hello, can you hear me?
Yes, please go ahead. I can hear you.
My name is Dime Mabel in quotes. Please,
okay,
I want to ask, which one are we? Are we in CNA or a caregiver?
Okay. Mabel. It's funny, Mabel.
Yeah, I know because from your explanation, that's why I asked. So I really want to know which one are we, or we are running both, or I don't understand.
No, we are not running. I guess you are asking this question
Please, I also want to ask a question concerning this CNA.
Let her finish answer my question first. She's breaking. I can't hear her properly. Sorry.
I also have a
Responses
question to
that
ask.
I have given, as in people
I
asking
can't hear your
difference
explanation. No. Your explanation is not
between the
clear. I can't hear you.
two. Am I right?
Jesus. I can't hear you.
Hello, Mabel.
Yeah, I can hear you now. I wasn't hearing you before. Please,
Hello,
can you go?
I'm
God.
coming. Please,
Okay.
let me hear. I'm coming. I wanted to answer. I don't know why. Is it the network we are? I don't know. So if you
Okay, let me carry this thing. Yes, and I'm putting it. I mean, police report on you. Near above VFS, near my fast.
No, sorry. Yeah, she help us mute too.
Is anyone here? What is happening? Because I can't hear anything anymore.
Can you hear me? Oh, Jesus, God help us today. Are we together? Can everybody hear me?
Yes,
We
ma'am.
cannot hear you, but we lost you for a
Yes, we
bit.
cannot hear you, but we are not seeing anything on the screen.
We can hear
Yes,
you, ma'am.
when there's a
We
network
can hear, but we
fluctuation,
cannot see anything.
fine. I'm trying to do it again. When there is a network fluctuation, this is what happens. I don't know. Let's pray that network would help us today. So, Mabel, I was trying to say that this is a caregiving, I beg your pardon, this is a certified nurse assistant training and not a caregiving training. But we've had a couple of questions, like Joy asked, because she was also in the caregiving training. So she wanted to know the difference between the two. So this is a certified nurse assistant training. I guess that's okay, Madam.
It's okay. If you can hear me, it's okay.
All right, thank you.
Yeah, me, I want to ask a question.
Wanted to ask. Yes, please go ahead and ask.
Yes, Charity want to ask a question. My name is Charity.
Charity.
Yeah, my name is Charity. Yes, listening from Liberia.
Okay.
So I want to ask now, since you say that the difference is clear, like the CNA is different from caregiving in terms of working with nurses and all that. So now, as a certified nursing assistant, can you also work as a caregiver with this particular certificate we are getting now? That's what I want to ask.
Okay. Now, a certified nurse assistant is a caregiver. Like I told you, if we look at the literary meaning of a caregiver, caregiver is someone that actually renders care to anyone that needs, a vulnerable person or an ill person. So if we look at it like that, but the fact remains that as a certified nurse assistant, you cannot, you can act as a caregiver, but you cannot actually function.
But she not going to reach here tomorrow.
Who is doing this to us? Please, let's kindly mute. So Charity, can you hear me, please?
Yeah, I can hear you. You said I can do what
so
and what?
It depends on,
I can't hear you.
Yes, it depends on what you want to do. It depends on what you want to achieve. A certified nurse assistant is a caregiving qualification. That is to say you can work as a caregiver, but you would only work within the confines where you would be supervised by a registered nurse. You understand me? Because a caregiver, you can work anywhere. You don't need the supervision of a registered nurse. You just need to liaise with the health team, maybe the family member, the doctor of your client, and so on and so forth. But a certified nurse assistant is a specialized field of caregiving. Is a specialized, okay, that's the best way to explain it to you. It's a specialized field of caregiving. It is not a general one. A general caregiver can work in the general sense, but a certified nurse assistant, you cannot work in all settings. You are more of a specialist, and you can only function with this certificate when you work in the confines of a hospital that you are being assisted or supervised by a registered nurse or a licensed practicing nurse or a licensed vocational nurse. So that is the difference between the two. It is more specialized, it is more regulated, if you understand what I'm trying to say. But a caregiver is not really regulated. Anybody without the nitty-gritty knowledge can actually work as a caregiver. But as a certified assistant, it is more of a regular, of a specialized setting than that of caregiving. So I don't know if that has answered your question.
Yes,
hello,
yes,
Charity.
yes, I understand.
Please,
So
I have
in
a
other
question,
words now,
please.
I can.
Please, I have a little bit
Our
of
questions,
clarification.
our questions are okay. Let's bring it on, but I'll crave your indulgence because these questions will make us definitely exceed 8 o'clock. But I love them because I want to learn from you. I need contributions and questions. So let's ride on. Who is asking? Mr.
I am the one.
Isaac.
My hand is up.
Okay, who is the person? Okay, Patience, I guess. Okay, Patience.
Yes, please.
Go ahead,
Okay,
please.
thank you very much. Although most of those questions are very valid, but network did not let us hear your responses. I believe that they will come up again sometime. But I've gotten a lot of
Don't
clarification
worry,
on
the
some things.
recording, you get it.
So one thing I know is that, maybe for some countries, or even if you take Canada, for instance, even within some provinces, they just have different things that they call, different aspects of care. One that is very prominent is the continuing care assistant. So my question is, the continuing care assistant, will it be more of this certified nursing assistant? Will it play more on that role, or it will be on the the caregiver, general caregiver angle?
Okay. Now, if I may understand your question, continuous nurse care assistant,
Continuing.
CCA, that's what it is.
Yes.
Continuing, yeah, continuous. Some people call it continuous too. Is CCA, that's the acronym for it. Now, it's more, it depends on the setting. There are settings that are residential, that's for long-term care. Long-term care, that's someone that needs the person is in the hospital facility and has maybe a terminal illness or something that needs a long-term care. So in such a setting where we have that continual assistance that you have to render, you can equally, a certified nurse assistant can function effectively in that setting too. I don't know if you get what I'm trying to say. Can you hear me?
Yes, I do.
Because network
yes, I do. But it has to be within the
yes,
care,
that's what I'm saying. It has to be confines of a particular facility. Yes, that's what I'm trying to say. It has to be within the confines of a particular facility, because the people that actually need long-term care are people that need to be maybe in a long-term facilities, residential facilities, where most times you get to have more than 1, 2, 3 people, maybe something like a hostel, if I may use that, where you have to keep tabs on people and they need long-term care. So it can very well, you can use a certified nurse assistant. Can work, it can be substituted or it can work together. That's just it. So do we have any other one? Any other question, please? Mr. Isaac, okay, Mr. Isaac, was your hand up?
Hello, please, I
Hello.
have a question. I have a question.
Okay,
This is
all right,
Nenna
please.
speaking.
Please, okay, Nena. Wow.
Yeah.
It's nice to have you here, Nena. That name, I was
Yes,
just wondering if
if I
that
was there. Okay, I'm here.
rings a bell.
I'm here. Please, my
We're
question.
actually talking on the platform. Go ahead. Go ahead. Yeah.
Yes. My question is based on what you said earlier, that a CNA can advance into maybe being a licensed nurse or practicing nurse, whatever. But how can that be possible? Is it that within particular years of experience you become that, or do you need to get any educational whatever before you become a practicing nurse or a licensed nurse?
Okay. Now, thank you for that question, Nena. Okay, if you are done with it, there is something I want us to understand. Certified nurse assistant is the first, is like a stepping stone in the nursing hierarchy. It's like a stepping stone. It's the first stage, like you are climbing a stair, you are climbing the staircase. The very first step is certified nurse assistant. Now, if you want to continue to go higher in the nursing hierarchy, then you have to have the educational qualification. 2, you would stand a better chance because you already have the experience and you already have the certification as a certified nurse assistant. You would stand a better chance to be able to pursue a higher, pursue your to move higher in the nursing hierarchy. I don't know if that's understood. What I mean is this. Yes, nurses, you know, we have the BS, we have the nursing qualification, you get a degree in nursing, we have other, for you to become a licensed nurse, there are so many procedures, there are so many procedures to follow. It's highly, in the nursing field is highly regulated, you understand? So before you can actually ascend higher, it will be a plus for you with a certification in as a certified nurse assistant, and with experience, maybe you've worked with it for some time, it's going to be a plus for you to pursue your maybe BSc nursing or to move higher to become a registered nurse, as compared to someone that doesn't have that stepping stone, that doesn't have that footing. So if you want to continue higher with this, your CNA, all you need to do, depending on the states, because like I must tell you that different countries have their own different policies, they have their own stringent measures, depending on the country that you may wish to work or you may wish to go and function. So with that CNA, it gives you an edge, it gives you a ladder for you to climb up higher easily than someone that ordinarily did not have that CNA certification. In the Nena, if you are okay with that. Someone is saying,
yes,
I'm not
I'm
hearing
okay.
anything. Okay. So
Yeah,
I'm okay.
that is what I tell, so that's what I tell people. With a certified nurse assistant certification, is very easy for you to be able to gain admission, gain the experience, and move higher in the nursing hierarchy. Because you, from there, maybe if you want to, like I've told a couple of people that I talked to, that if you want to be a nurse, then it is better start as a certified nurse assistant, then progress with the experiences you are having in that your job, and then progress, do carry out studies, go further, higher educationally. It will give you an edge because you'll be easier for you to be a registered nurse with that foundation that you already have. So do we have any other question before we move our time? Are we sure we are going to complete what we
I have a question.
Questions. Wow. All right, bring it
I have
on,
a question.
please.
I want to know the difference between licensed practicing nurse and certified nurse.
Okay, licensed practicing nurse, LPN, is like a registered nurse. Okay, in the hierarchy, the registered nurse first, then the licensed practicing nurse, then certified nurse assistant is not on the same line with them. What am I trying to say? That CNA, like I said earlier, is not on the same line. The registered nurse is licensed, has more years of experience, has taken more certification, that has a higher certification than the certified nurse assistant. The certified nurse assistant is just the stepping stone, you understand, in the hierarchy. So a licensed practicing nurse, a licensed vocational nurse, a registered nurse, all those ones are higher up there. But a certified nurse assistant is just the first step. It's just like a stepping stone. So they are not the same at all. That's why in the course of this, some people were trying to ask questions. They were saying certified nurse assistants, they should be taught how to, they wanted to know if they can take blood, maybe they can do the duties of the registered nurse. I said, no, it is not. It's against their ethics. There are things that you don't do when it comes to medications, diagnosis, all those things that nurses do, you don't do it. You don't do it. Your duty is just to do activities of daily living and maybe taking vital signs and maybe monitoring blood pressure and so on and so forth. So they are not, they are totally different. The LPN, the licensed practicing nurse, and the vocational nurse, all those ones are in the higher hierarchy. The CNA is the stepping stone, is the first step on the ladder. So
Okay.
yes, so that's it. They are not the same at all.
Yes,
not.
I have a question.
Sorry, I have a question
This
too,
was
please.
another hand. Yes, there was another hand.
I have a
Please
question.
ask.
Yes,
Can you hear me? Can you hear me? I
Yes,
have
I
a
can.
question.
Yes,
Very
I
short
can hear you.
question. Very
Which
short
person's
question.
voice? Which person's voice is like?
Mabel
faster?
is coming.
Okay,
Mabel is
Mabel,
coming.
Mabel, go ahead, Mabel.
Sorry, I know my questions might be shocking to you, but I just want to ask this one. This CNA certificate we are getting, are you saying we can majestically walk into a hospital, maybe private, and say we want to work with them, or we want to develop a career with them too? Please, which one? I don't understand. Are we going to be trained as a nurses or given employment in Nigeria? I'm talking about Nigeria, or not outside the country. Do you get me? Hello?
I'm trying to hear you. It's actually breaking. Yes, I'm hearing you, Mabel. I'm trying to hear you. Hello,
Okay,
Mabel. I'm
okay.
hearing you.
Okay,
hearing
I
you.
said
If
I'll come
understood
again.
what you are saying, if I understood you, what you are saying is, with this certified nurse assistant certificate, that can you walk into any hospital and want to work there as a certified nurse assistant? Is that what you mean?
Yes, exactly. Or will
Yes.
they employ us, or are we going to be trained again as a? Are we going to be trained on their own terms or what? I don't understand. That's what I want you to explain to me.
Okay. Now, what I want to first and foremost tell you is, with your certificate, by the time you finish the program and you have your certificate as a certified nurse assistant in healthcare, you can walk into any hospital and submit, maybe apply, not to walk in, or you have to apply, of course. You can apply in any hospital to work as a certified nurse assistant anywhere at all. You can quote me anytime, any day. You can work with your certificate. You know why? Because you would, in this particular training, before you have the certificate, like I told you, everything that a certified nurse assistant does, you would be put through, even though it's an online training, but technology is nice. You are going to see how it play out. You will learn everything, how to make the bed, how to transfer the casualty, every damn thing that you need to know. And after that, you'll be certified. That is why the certified is there. Certified means that at any point in time, you are able to actually do that work. You are able to carry out your duties judiciously as a certified nurse assistant. So with it, you can walk into any hospital with this certificate, and you can be taken, you apply, you can be taken as a nurse assistant. Please take note, again, I still emphasize, take note that this is not a nursing training. This is not a registered nurse training. I want everybody to understand. So you cannot use this and walk into a hospital say you want to work as a nurse, no hospital will take you because this is certified nurse assistant. From that word assistant, you are not a registered nurse, and you cannot do the duties of an RN. So, but as for your own duties within your own job specifications, you can work anywhere as a nurse assistant, but you would work under the supervision of a registered nurse. So that is it, madam.
Thank you so much. Well understood.
Okay, let's go on. Let's go on, ma.
Welcome. So someone wanted to ask a question. I like to take everyone's question. Is there any other one?
Yes. Yes, I want to ask.
Okay, please, if there's anyone, ask. Mr. Isaac, oh, I'm sorry, the
Yes.
man among women.
Yes.
Mr. Isaac, I'm sorry. I saw your hand, but you know, somehow I got lost. Sorry, please ask your question, Mr. Isaac.
Yes, so I was considering whether you are taking side with the women.
Oh, no, not at all, Mr. Isaac, not at all. Please ask your questions. Forgive me for that oversight.
Before I ask my question, I would like to suggest something more. You see, it's like our questions are coming to me, and I like the way the questions are coming because it will broaden our understanding.
I've lost you, Mr. Isaac.
Can you hear me, ma?
Hello, Mr.
Hello.
Isaac.
Yes, can you hear me?
Yes, I'm
Can you
trying
hear
to
me, ma?
hear you. Okay, yeah, I can hear you. I can hear you.
All right. What I'm saying is, before my question, I would like to suggest something.
All right, sir.
Yeah. All right. It's like the questions are coming too much, and it's good because it will broaden our understanding in this CNA course. The more the questions, I think the more insight and understanding we get in this. But what I want to ask is that you were saying something about our values as a CNA practitioners. And you said something that we have to be compassion with our patient. We must have compassion on our patient. Now, naturally, there are some patients who are very irritative and arrogant. Okay, so when you meet such patients, how do you handle them?
Okay, thank you so much, Mr. Isaac. I've had that question come in severally. We are going to eventually get there. You know, this training is very rich. This training is very rich. We'll get to how we can handle challenging behaviors. That's the topic. Challenging behaviors is in one of our modules. So you'd see how best you can handle challenging behaviors. But before we get there, just to maybe give you a little bit of it before we get there. Yes, people are different. As a CNA, as a certified nurse assistant, you have to take note of differences in people, individual differences. And one of your ethics is to ensure that your client has independence. You have to ensure that you carry your client along, you respect your client's dignity, and you ensure that you don't take away the independence from your clients. So when we get there, we are going to see that communication, we'll get there when we are talking about communication skills. Then you would see that no matter how difficult a person is, that you just need the right key to unlock that person. You just know exactly what to do when you come face to face with such situations. We're actually going to treat that under communication skills. I think that should be tomorrow or next week. I'm not too sure right now, but would see that there are methods. That's why we are having this training. There are methods you can handle such people and what you can do in some situations like that. So, Mr. Isaac, I guess
okay,
that has answered you for now. You see how we get. When we get there, I'll surely get there. So, if there's no, let's move.
Madam.
Yes, please.
Madam, I have a question.
Yeah. Yes. Who is asking this?
Yes, in context to the primary.
Please go ahead, sir. Tell us who you are before we move, because our.
Okay, my name is Muila.
Hello, sir. I've lost you. Ask your question.
Muila. My question. Can you hear me? Hello.
Yes, I can hear you now. Yes, I can hear you now.
My name is Mwaba.
Okay.
So my
Mwaba.
question,
That
yes,
name does not ring a bell.
yes.
All right,
So
sir.
my question goes in context to the primary, secondary, and tertiary. So on these, on the level of primary, tertiary, and secondary, can you hear, ma'am? So for certified nursing assistants in primary health care, I see their nurses working hand in hand with doctors as well as nurses, as well as.
Your network is actually, I'm struggling to hear you. Please, can we hear Mr. Mwaba?
Can you
Or
hear
is it
me?
my network?
Can you hear me?
Yes, ma, it's from your network. I can hear him clearly.
Yes,
Can
ma,
we
I can
hear
hear him.
him?
It's from your side. I think it's from your side. I can hear him clearly.
Can you hear me, ma'am?
Clearly, loud and clear. We can hear him loud and clear.
So it's from his network. I cannot hear him. Mr. Mwaba, I cannot hear you.
No,
I can't hear him. Can't hear the
it's from-
question.
Okay, Mr. Mwaba.
Okay, okay, I'm going to ask at the end of the lecture, please, if you can't hear me properly.
Yeah. Hello, please, coordinator. He said he's going to ask the question at the end of the lecture, so we can move
Yes,
on,
we're going to
please.
listen at the end of the lecture, such that we don't beat time.
Can you hear me too?
I can hear you. I can hear you.
Okay. I don't know. She's not hearing me. I was trying to pass your information to her.
Yeah, you tell her I'm going to ask after the
Yeah.
lecture.
Her network is
Okay.
bad. See, the network is very
Okay.
bad. The display she set up is disappeared. So maybe when she's back on track, then she can.
Are we together?
I think we can hear ourselves, but she's not here.
Hello?
Hello, are
Her
you back?
Her own network is bad. She's not.
Network is
think your
just not
network is
friendly
bad.
today. Wow. Don't like this now. Network, please. Can you hear me, everyone? Are we together?
Yes, I can hear you.
Yes, I can hear you. We can hear you now.
Yes,
you can hear
we
you
can
now.
hear you
We can hear you now.
loud and clear.
I can hear you.
It's coming up and down.
Help us. So today is not very, I don't know. Is it the protest, like someone said? Could the protest be it's not helping us today?
It's from the weather.
Okay. It's terrible. It's terrible. I've had to change my network to swap from MTN to Airtel, and I don't know what else to do. But God would help us. Let's go. Mr. Mwaba, I couldn't hear you, so maybe you can just help me by chatting, by typing it in the chat box. You can hear me.
Can you hear me? Can you hear me now,
He
madam?
will ask
Okay,
this
let's
question at
move.
the end of the lecture.
Let's
So
yes,
let's
that's
move
what I
on.
want
He
to
will ask
say,
this
please,
question at the end
so
of,
that we can be able to move. Let's take the questions at the end. Yeah. Thank you. So, Mr. Mwaba, please, you can drop your questions or at the end. So let's move to what we have. We're talking about the duties of a certified nurse assistant. Like now we can see the certified nurse assistants, the duties, taking vitals, examining patients, communicating effectively, attending to to patients' hygiene, providing mobility assistance and so on, clean patients' rooms, assist patients with eating, prevent infection spread, and so on and so forth. So these are actually some of the things that we are going to be doing as certified nurse assistants. So we want to look at healthcare settings and professions, like we have already talked about. Hospitals, we have outpatient clinics. We have a whole lot of places that healthcare professionals or practitioners can actually can actually work. So now we want to look at we've come to the main, all those ones, we're just having preambles, we're just having the introduction part of it. Now, there are ethics in every profession. There are ethics in every profession, as it is with the certified nurse assistant. There are ethics in all those professions. So now, and these ethics are simply the principles that guide decision-making and actions of a certified nurse assistant. Like we all belong to different, we all do different work jobs, and we know we have ethics, we have professionalism standards that we have to adhere to. So on this particular slide, let's go to the slide view so that everyone can see it, even though it appears a little bit faint. We have the principle-based ethics, the rules, the codes, and the standards. Now, the ethics and professionalism of certified nurse assistants can be categorized into three major ones. One is the principle-based ethics, like we can see there. And then we have the consequences-based ethics, as well as the virtue-based ethics. These are different ethics in the certified nurse assistant profession. Now, when we look at the principle-based ethics, now this particular approach focuses on adhering to fundamental ethical principles, such as maybe respect for autonomy, your client's autonomy. You know that your client you have to have respect for your client's autonomy. Then beneficence too. Beneficence, very important. What do we mean by beneficence? Your code of conduct, you being kind, being affectionate, being considerate towards your patients, showing love, doing your job judiciously, regardless of race, regardless of religion, regardless of certain biases you have. That is beneficence. So for a CNE, this particular ethics, principle-based ethics, talks about respecting your patient's right to make informed decisions. It's very important that we, as CNA, as a certified nurse assistant, respect our patients' decisions about their care, acting in the patient's best interest too, but respect their decisions. I have seen a couple of times where people just superimpose what they want on their client, on the patients. This is what should be, without even taking into consideration what does this particular patient, what does my patient actually want? What preferences? We don't take into consideration the preferences of our patients. This is very, very important. For CNAs, principle-based ethics about you respecting your patient's right to make informed decisions, then decide for themselves about their care. Acting in the patient's best interest as well. You act in the patient's best interest. You avoid harm and ensure fair and equitable treatment. You are not biased. You don't say, because this one is my sister, this one is not my sister, this one comes from here and this one is not from here, I have to treat this one like this and I have to treat the other one like that. So these are things that fall within our principle-based ethics. As CNAs, we have to treat everybody equally. We have to obtain informed consent before providing care. Very important. This particular aspect cannot be overemphasized. Before you treat anybody, before you do anything, even if as much as, oh, you want to mop or you want to change the bedding, so you want to do anything, communication is important. When we get to communication, you will understand. Get informed consent. Let the person, oh, I would like to do this. I just like to move you around. I want to do this. Is it okay if I do this? Is it okay if I do that? You keep communicating. You get their consent at all times. This is very, very important. It's one of our principles. It's one of the principles of a certified nurse assistant. Don't do anything unilaterally. Yes, you know it's for the interest of the client, but you have to communicate. You have to get feedback. You have to get informed consent from your clients, from your patients, before you actually go ahead to do what you want to do. So that is primarily the aspects of the principle-based ethics. It talks about how, like I said, respecting your client's rights and autonomy and so on and so forth, and very important, ensuring you don't bring any form of harm to your patient. That is the aspect of the principle-based ethics. Okay, now let's look at consequences-based ethics outcome. Consequences from the word already. We already know consequence, what happens as a result of something, consequences. So this consequence-based ethics emphasizes the outcome or consequences of an action with the goal of maximizing the overall benefit and minimizing the potential harms. Now, for a certified nurse assistant, this particular aspect would involve you carefully considering the potential impact of their decisions and actions on the patient before you carry out any decision, before you carry out any action, before you do anything, even if it is in the line of your duty. Stop, pause, and consider the potential impact of that particular thing that you are doing or of that particular decision that you are taking on the patient. That is the part of the consequence based. For instance, maybe you discover an abuse. Maybe you discover that there's a form of abuse or neglect on your clients. Maybe your patient is being neglected, or maybe is being abused one way or the other. Now, reporting suspected abuse or neglect to protect the patient's well-being, even if it may strain the relationship with the patient or their family. So you see consequences. Sometimes, like I said, that you have to connect with your patients for you to really, really feel or understand what your patient is going through, and you have to be empathetic. Now, in the course of it, maybe you observe something, maybe for instance, an abuse, like I'm trying to say. You will be torn between, oh, should I report or should I not report? You understand what are the consequences if I report, what is going to happen? You know, you look at the decision, the impact of whatever decision that you make about that patient. And do not forget that maybe even you reporting can strain your relationship with the patient. Maybe the patient did not want you to report, but because you are acting at the best interest of your patient, you have to follow due process and especially report to your in-charge nurse, your nurse that is in charge. Like I said, you are supervised by a registered nurse. So there's hierarchy. You report to your in-charge nurse first. And then maybe if it's a severe case of abuse or anything, it can be handled from there. So that is one of the ethics of your job. Consequences based, even if there are consequences, you have the right to report anything that you see because it is at the best interest of your patient. Now we have the virtue-based too, ethics, now, which is the third one in the circle. The virtue-based ethics, what does it have? Now, this focuses on the character and moral virtues of the individual. Your own moral virtues, like I said, I started by saying that you need the passion to be able to work in this particular field. You cannot just move into certified nurse assistant, becoming a certified nurse assistant just because you want greener pastures or you just want to have a job. No, it has to come from you. It has to come from within. You have to be ready to render service to humanity. You have to just come all out of yourself, do what you know you can do. So for this, demonstrating these virtues, you have to be compassionate. You have to provide patience. Whatever you do, do it with your heart, with kindness. That is the aspect of virtue. Let kindness be one of your virtues as a CNA. Be empathetic. Show patience when you are dealing with these people. Understanding, even in challenging situations, because sometimes you may have to, like some of the CNAs have complained over the years when I do this training, that, oh no, this person is actually problematic. I need to move around my rounds. By so time, I should be done with feeding the patients. I should be done with doing this. I should be done with doing that. But if you actually have this, you uphold this, your virtue-based ethics of your profession, then you would be patient with these people. You will be patient with them, understanding that it is the illness that has actually made them to be what they are. So in practice, generally, it is important. You need to balance the ethical principle of respect for your client when assisting them with anything at all you want to render to them when assisting. And so these are practically three situations or ethics and professionalism that has got to do with certified nurse assistants. as a certified nurse assistant, you have to have, and your integrity has to be top notch. You have to have a high level of integrity. You don't take things that don't belong to you. You know your limits. You don't exceed your limits. You maintain a high level of professionalism. You don't get emotional with your clients in the sense that, what am I trying to say? We are all human beings, yes, but you know where to draw the line. When certain things that look unethical, you don't. Maybe some receiving gifts, cash gifts from your patients, and maybe giving you things and all those type of things. No, you should have your restrictions because it doesn't fall in your ethics and your professionalism as a certified nurse assistant. So, okay, now let me just give you a scenario. So that you really understand what I am talking about. But before I do that, I want to give you some practical examples. Before I do that, I want to find out if we are together. Mr. Isaac, your hand is still raised. I suppose you don't want to ask a question for now. So are we together? Can everyone hear me?
Yes, ma'am, we can hear you.
Yes, we can hear you.
Loud and clear.
Okay, I need us to be too. So I want to now break it into examples because the way I teach, I like to make it understandable to everybody. I like to teach. I don't like to train. I like to teach. So let's see. We want to look at some examples. Respecting patients' autonomy. Remember, we talked about principle-based ethics, and we said importance to respect a patient's autonomy. Now, for instance, a CNA, certified nurse assistant, is assisting an elderly patient with bathing, and the patient expresses a preference to use a special type of soap. Maybe you're assisting with bathing, and the patient said, no, I don't want to use the soap. I want this other one. And the CNA, what do? You have to respect. The CNA needs to respect the patient's autonomy and allows them to use the preferred soap, even though the CNA may personally prefer a different product, you see. So what does that take care of? That takes care of your own ethical principle of upholding respect and autonomy for your clients, which is you recognizing the patient's rights to make informed decisions about their own care. You see what we're talking about. So that gives you a picture. Sometimes in your practicals, like I started by telling you that all these things that I'm saying, it may not really, to 70% may not make real. Maybe you may still be struggling with some of it, one or two, but eventually, like I said, CNA trainings is mostly practicals, like the core things is in the practicals. That's why we have more days for practicals. So by the time we delve into the practicals, you are going to see live how we can handle some of these behavior challenges, some of them, because of course you will see them. People are different, and as we are different, so you will have different challenges in the course of your duties. So that was about the principle-based ethics. So now we want to look at consequence-based ethics, reporting suspected abuse. Let's look at that. So maybe a CNA, in the course of you bathing your clients, you notice signs of potential physical abuse on a patient, maybe bruises or unusual behavior on your patient. Now, you as a CNA, you consider the potential consequences of reporting the suspected abuse. You think of it, I can see these bruises. If I report, you think about it, something you ponder about, whether you should report, including the impact on the patient's relationship with their care with you. That's their relationship with you, because some may get angry that you are actually reporting this abuse situation, maybe reporting that you found bruises all over them, or authority, and the potential for further harm. So the most important thing for you to do is for you to see how best, because of your ethics, to ensure that that particular situation is reported regardless of the consequences. That is what it means. You have to, because your paramount interest is in the betterment of your clients. And don't forget that a CNA works interwoven with other people. You cannot work on your own. You have your in charge, your immediate supervisor. So it is advised that as a CNA, any little thing, bam, like this that occurs, report to your in charge. Tender it, documents. We are going to get to documentation and report. Whatever you know that you observe, because you are going to be firsthand to observe the things that happen. Do not waste time. Report them to your in charge. Report them to your team. You are a team player in the you are a player in the team. So you have to ensure that you report these things appropriately. So we have talked about that, the consequences-based ethics, and then we want to virtue-based ethics and character. Now let's start this one for the character now. Now, demonstrating compassion, like a certified nurse assistant, because you are rendering care, you have to demonstrate compassion. So if a CNA, for instance, a CNA is assigned to care for a patient who is terminally ill, who has a terminal illness, and is experiencing distress, significant distress, you know how it can be. So you, the CNA, recognizing the patient's suffering goes above and beyond in providing emotional support. You recognize that this person is passing through a lot. You understand how the person feels. You engage in listening, in active listening. You ensure that that patient is comfortable and dignified, even in the midst of that illness. That's what I want us to understand. Even if it requires extra time and effort, you go out, ensure, because compassion is one of your ethics. You have to be compassionate. So you go out of your way to ensure that that client is actually comfortable and is actually happy. Give that shoulder to lean on. Give that, let the person know, I understand how you feel. You can get past this. You can get through it. You know all the things you need to do. These are things that are very important. So summarily, that is the aspects that we are looking at. So I don't know if we are together, like everybody heard me all through that particular place. If you understood me and if this, are we together? Did we understand? I just need the answer. Oh, no one is actually hearing me.
Yeah.
We can hear
We
you.
heard you. You understand?
Yes, I understand. Yes, I can hear you. I understand.
Okay, and you know where I always like to start?
Yes, I can hear you.
Thank you. I've had situations where people just plug their devices in and off they go. They go to do something. Okay, Mr. Uzokalu, we said that questions will be asked at the end of the training, but you can still ask because, well, let's see how it goes. Mr. Kalu, I don't know if it's Mr. or Miss.
It's Miss Ma. Good evening, Ma. Good evening, Ma.
Please. Okay, ask your question in a brief, yeah.
My question is based on this ethics and professionalism. So now you threw more light on the confusing question there is, I want to ask that you throw more light on the consequences-based ethics and this vital-based ethics.
Okay, not vital, but virtue-based ethics, right?
Ethics,
okay.
Yes.
What I was saying is consequence-based ethics. For instance, you are reporting suspected abuse, consequence-based ethics. Let's use that one, or any reporting that you have to do, whatever you want to do, weigh the consequences. If the consequences, or rather if the health or the importance of you making that observation outweighs the effect of it, then you go ahead and make the observations or make the issue known. For instance, like we talked about the reporting suspected abuse. Now, you notice something, physical abuse on a patient, maybe your client. Now, the CNA considers potential consequences of reporting the suspected abuse, including the impact on the patient's relationship. Now, consequence-based ethics is that sometimes there are some things that you may want to report. You understand? And before you report, because it's in the line of your duty, it's ethical for you to do that. You have to weigh the consequences. Okay, I want to report this bruises to my client. I want to tell them this is what is happening to my clients. But if I tell them, it's my clients, my patients may feel bad that I maybe reported, or something may go wrong. But the most important thing, because of your ethics, the most important thing there is so long as what you are reporting to the best interest of your client, that is to say that it will help your patient get better. For instance, if he's abused by someone and maybe raped or something like that, it is important that you report. So your consequence-based ethics is that you have to ensure that you report what needs to be reported, regardless of the underlying effect of maybe the patient being angry with you or any other thing that may come backfiring on you. Number one thing is that you are to report anything that poses as harm to your patient at all times, regardless of the consequences that may later come to you. I don't know if that's fine. Uzoma, do you understand that if I go to virtue-based?
Yes, ma. Yes, ma.
Okay. All right. So virtue-based, like you wanted to know. So virtue is character, your ethics. What are those traits that you have? Comfort. Are you an amiable person, or are you a person that shouts on your patients? Are you a person that doesn't know how to communicate effectively with your patient? When we get to communication skills, are you a person that can't contain with your temper? You can't understand another person's preference. These are some of the things. So your character is very important. You have to be at all times. You have to be compassionate. You have to have an atmosphere that will make your client to be able to relate with you. You have to connect. You have to be dedicated to your job, and so on and so forth. So virtue has got to do with character. Consequences has got to do with you doing the right thing regardless of consequences. So that is the difference between the two. I have seen Yelson raise the hand. Wow, today our training will surely exceed 8 o'clock. That's actually.
Yeah, I'd like to add this one real quick.
But all the same. Yelson.
Yeah, I'd like to add this one real quick. Can you hear me, please? Can you please hear me? Hello?
Yes, I'm trying to. Yes.
Yeah, okay. I think in your submission, you said, if your client insists on maybe if you have soap the client needs to use and your client insists on a particular one, you need to adhere.
Correct. Yes, you need to adhere, because that takes care of autonomy and takes care of preference as the patient. Okay. Go ahead.
Yeah,
sir.
so you are the first-hand health professional around the person. So everything that goes into and outside the person is determined by you. So if the person insists on a particular product or drug, and then you think this is what has to go on the person, must you go by what the person says? Oh?
Mr. Yelson, I'm struggling to hear you. Oh, this is really bad. Okay, I can't hear you anymore. I can't hear you anymore. Mr. Yelson.
Yeah, can you hear me, please?
Yes, I am struggling. Go ahead. I'm struggling.
Okay.
I can hear you.
Yeah. So let me run it up real quick. So, do you have to be insistive when it comes to what goes to your client, or if your client suggests something, maybe suggest something or feel like this is what I want, but isn't good for the person's health? Do you have to listen to that, or you strictly stick by what should go to the person?
Okay. Oh, thank you so much. That's a good question, Mr. Yelson. Now, that is why it's important as a certified nurse assistant. Like I said, you don't work unilaterally, like you work with a team. It is important, number one rule, I see it done in some places, but number one rule from what I learned and what is obtainable, the patient has autonomy over that, has to make informed decisions for himself or herself. Now, if you are bathing, like I said, sometimes, that's why I say when we get to that place, we really discuss on it so you would understand what I'm trying to say. But the patient, like that soap, the patient had a right to say, okay, I'm going to use another soap. Sometimes it may be that the soap is the kind of soap that will be dangerous, would endanger your patients, and you want your client to use that soap. So in such situations, what you need to do, like I said, it is very important that you don't take any decision on your own, and you follow it with wisdom. What I mean by wisdom is that communication is important. If your client wants to use a particular soap and you know that soap is not good, it is important that you tell your client, okay, this soap that you want to use is not good. I am thinking that, can you use this? Or why do you really want to use this soap? So we can look at alternatives. This thing is always something on around, I don't know how to put it, works around the care team. The care team work together. And as a certified nurse assistant, you work with your in charge. So any little thing that happens, relate with your in charge is very, very important that you relate. And again, like I used to see people force, maybe done in some hospitals, they force patients to take drugs. Patients don't even know the drugs that they take. And these things don't work, because especially if you are going outside the country. Now in Nigeria, here and maybe in most parts, anything goes. But when you go out, you can even be sued for superimposing what you want on your clients. It is not right. It's against the ethics of the profession. But what you can do is, if you see that your client, when we get to that, it's one of the slides that we are going to take, one of the modules that we are going to take. We'll talk about it extensively, because these questions have always come anytime I have this training. So when you are faced with such situation, the best thing for you to do is not to outrightly say, no, you are not to use that soap, or to be disrespectful, or not to make your client feel less of a human being. No, what you need to do is to explain to that person why the person doesn't need to use that soap. If the person insists to use that soap, then fine, you report to your in charge. Let the care team be aware of what you are going, because you don't stand alone in a healthcare team. Why? Because if anything happens as a result of that soap, you'll be held responsible. That is why documentation and reporting is very, very important, which we'll get to as one of our modules. So the important thing is that do not deprive, because what kills people faster is that you deprive them of their control in their lives. When they lose grip, anybody, it's very easy for you to break down if you are eventually absorbed of your control. You are no more in charge of your life. Everything is superimposed on you. No. So one of the things a certified nurse assistant has to do, that's why we say before you do anything, communicate, get informed consent, let the person be in charge of his or her own life. All you need to do is just to lend a hand and support within your own job description as a certified nurse assistant. So I don't know, Mr. I don't know. I've forgotten Mr. Ben or so. Have I been able to? Okay, Mr. Yelson. Is that? Are we okay? Are we on the same page?
That's well taken. That's well taken.
Okay, thank you. So okay, Mabel, your hand was raised. Okay, fine. Mabel.
Madam. Yeah. Sorry, ma'am. My question is, please, can you go back to the other slide of healthcare setting and professionalism?
Okay, that's healthcare. We've already gone past that. We are going to be okay. I hope everybody will bear with us if we exceed 8 o'clock, because today network, but surely we would not. Are you talking of this one?
Yes. I wasn't here when you repeated it. If I may say, I just saw it and you said, oh, please, can you throw more light on it?
Okay, healthcare settings. What I mean by healthcare settings and professions, healthcare settings, hospitals, that's places where we have healthcare. That's primarily what, in hospitals, you get to see doctors, you get to see nurses, you get to see certified nurse assistants, and you get to see the people that work in the hospitals. Then we have outpatient clinics. We have clinics for patients that just come with maybe illnesses, whatever, maybe they need to see a general practitioner, and they just walk into the hospital, outpatients. They don't stay there. When they are done, they leave. We have long-term care facilities where people are really, maybe people that are having terminal illnesses, stay, you understand? Maybe they are, so that they will be monitored, and then maybe stay overnight, stay for days, and the continual monitoring. Then we have the long-term care facilities as well. like I talked about, the long term where you stay for a long time, the patient, maybe a person having cancer will not just be discharged, has to go through chemotherapy, has to do a lot of work. So the person is actually admitted there. The person is there in that long-term care facility. Then we have the home health care too. We have the home health care settings. We are talking about settings too, where maybe you have to take care of a person in the home. Like in the home setting, maybe your mother is elderly, you get a nurse to take care of her, maybe a certified nurse to take care of her. And then we have the community health centers too, where you go for maybe immunization. We have it around environment. So all those places have professionals, doctors, they are all members of a care team, of a healthcare team. That's why I had to put it there, so that we can have an idea of the different healthcare settings. That's why we had it. So, Madam Mabel, are we good to go? Network. Hello, Mabel. Are we together?
Yes, we are
we
together.
can
I hear you.
Okay, Mabel, are you okay with that? Okay, I guess we've lost Mabel. I cannot hear her. All right. So these are some uniforms depending on the places that you can find, yourself. So it will depend on the place, depends on wherever. Different places have their uniforms and so on. Okay, Mabel, your hand is still raised. Mabel, can you hear me now? All right, so we have, like you can see, the uniform. Some wear the light blue, the blue, some people wear brown, different types of uniforms. I just had to put that so that we can have an idea of what we are practically looking at. So let's see, we are still talking about ethics and professionalism. Still talking about ethics and professionalism. Now, these are some of the things that we need to know, we need to do as healthcare practitioners. These are some of the things that we need to do. And one other hand raised, Willa. Okay. It's like I am not someone is saying, let it not exceed 8 p.m. Wow. Okay, let's continue. So treat all clients equally with compassion. That is very important. And respect of their integrity, of their dignity. Do not make them feel at any point in time less of a human being. Be positive, be professional and tactical, and tactful in all the things you do. Promote the client's rights and the safety of your clients to assist in achieving the best possible health. All these things are very, very important. These are some of, thank God you are going to get to have the slides. So please do justice to them so that we can move. Keep them well-groomed to attend to your hygiene. That sometimes you get to see nurses, they fly their hair. No, you have to make sure your hair is wrapped. You pack your hair, you wrap your hair, your fingernails are kept neat, everything is kept in order. Your hygiene, take care of yourself. Do not report, go to work under the influence of alcohol. Be positive, be professional in all your dealings. And above all, depending on wherever you find yourself, different facilities have their different rules and regulations. And so you have to, as much as possible, try to adhere to these rules and regulations. And we would get the slides. So we are going to practically see how to handle what are the job ethics and what you need to do, what you have to do. Never perform a procedure or give a treatment you are not qualified to perform. Again, I repeat, as certified nurse assistants, you have your job description. You have what you are expected to do and what you are not expected to do. So at no time should anyone superimpose something that you're not supposed to do and you go and do it. But if anything goes wrong, you are going in for it. Make sure that the patient's welfare is of topmost priority to you. Carry out your duties to the best of your ability. Keep all information about patients and family confidential. Do not for any reason go out and discuss your your patient, and maybe even if he's your neighbor and he came around to the hospital or to the clinic, you go and divulge or disclose or discuss his or her confidential information with other people. That is very wrong for you to do. So now we want to look at ethical dilemmas. Sometimes, like I try to talk about, we want to look at ethical dilemmas that people face. Sometimes as CNAs, you get to face dilemma. Being between the devil and the deep blue sea. It happens in the course of our duties, in the course of what we do. We face certain dilemmas. And what do you do? Like one of us had asked a question, if you have someone that is this, what do you do? So as certified nurse assistants, you face a variety of dilemmas, of things happening in your daily work, which can arise as a result of maybe your interactions with the patients, maybe with the family, and maybe with the healthcare team. These are some of the dilemmas that you face. These are some of the situations that you are undecided, that you face in the course of your duties as a certified nurse assistant. Please, are we together? Are we together, or am I just busy talking to myself?
Yes, we are with you, ma'am.
Okay. Thank you. The women are with me. The men, please, are you with me? Are we together?
Yes, ma'am, we are with you. We are with you.
Can you hear me?
Yes, I can. Yes, I can
me?
hear you.
We are with
Yes,
you
I
on
can.
behalf of
I
the
want
men.
to ask a question. So, in respect of what you are saying, and there's this scenario whereby a dementia patient, as in a caregiver was attending to a dementia patient, so it's like she wanted to put on her clothes. You understand? So she did it the other way around, as in turning it upside down, as in turning it the other way around.
Yeah.
As in the dementia patient. So she was struggling with it. So whereby the caregiver came into her room, saw her struggling with it, came in to assist her. So she took the cloth from her and started, trying to reverse it to the other side. So at a point, the dementia patient started getting angry. She refused, started being aggressive. So at that particular point, what do you as a caregiver, what do you do? Because she refused didn't allow the caregiver to even assist her. She was so angry that they are being aggressive and all those things at that particular point.
Okay, thank you. Thank you for that beautiful contribution and question. Like I said, we have what we call challenging behaviors. That is it. That's challenging behaviors and how to handle them. We have those things. And when you are faced with such situations, you need skills, you need knowledge, you need to know how to go about it. Now, for you to be a caregiver, you have to, like I said, we are not talking about caregiving, but CNAs, certified nurse assistants, for you to be a certified nurse assistant and you are faced with that situation, what you have to do first and foremost is for you to find out there must be a reason. There's no way that person will be angry or will behave the way he or she has done if there's nothing there. And secondly, there are tips on how to handle people that have dementia. Dementia patients, they have their own characteristics they have. So you know how to deal with them. But if you treat them with respect, if you treat them with empathy, then they have this connection with you, such issues will be reduced to the barest minimum. Like I had when I was talking about caregiving, which we will also say here, we've not reached most of the questions you are asking. As we continue, you would see them playing just right out, and then you will understand what it is. Many times people have asked this question of challenging behavior. So we are going to get to see we are going to watch maybe 1 or 2 videos. We are going to see it practicals. At the end of the day, you see that there are ways you can handle these people. You can see how to rechannel their energy. You can see how to redirect that particular aggression they are feeling at that particular time for you to be able to do what you are actually supposed to do for them. It could be either as a result of so many reasons, maybe the manner with which the caregiver or the CNA or the certified nurse assistant behaved. We all have our ways, maybe pull the clothes, or why are you wearing, pull the clothes out and the lady is like feeling less of a human being. Oh, now I cannot dress myself. What's the meaning of this? And so on. There are a whole lot. If we want to talk about it, it's very, very broad. But of course, we are going to look at how to handle challenging behaviors. So as we progress, so we are going to see that. The
Hello,
last question I want to take, Mr. Waba, Mila, I don't know, Mila, or yeah, the Mila, please.
Yes, madam.
Ask your question so we can move. Yes, I can
Can
hear
you
you.
hear me?
Yes.
Yes, in context to CNA. I don't know if I got you clearly. You said a certified nursing assistant works because in the nursing hierarchy, the first is basically the primary level. So works in hand with what? With a nurse.
The registered nurse, yes, RN. Yeah.
Yes. So in
Works
view
under
of,
the supervision.
yes. So in view of autonomy, or rather the other example my colleague gave, he said, what if, let me give an example of maybe a particular drug, or let's say an NSAID, you know, a particular NSAID, rather you say, okay, this particular NSAID is good for my patient. And then that patient, because of the condition, that patient says, no, me, I don't want to take this particular whatever. I want to take the other particular, drug. So in my view, I think if the CNA works under supervision, so in such condition, are you supposed to, where you feel you don't want to have that conflict because of ethical rules, you don't have to have that conflict with a patient because she's not in her or his right sense of mind. Are we supposed to submit to the highest hierarchy, like the registered nurse?
Yes, yes. Whatever you do as a medical and as a certified nurse assistant, like I said earlier, still boils down to the fact that you cannot take any decision on your own. If you have a situation whereby maybe such thing plays out, it is in your best interest for you immediately to reach out for your in charge nurse, the registered nurse, because you know why? Because there may be a reason. That's why you don't totally roll out when patients complain, because there may be a reason why he does not like this drug and wants to take this other one. It may be the taste of it. It may be other factors, maybe how it makes him feel after taking the drugs and so many other things. So first and foremost, it has to be, that's why you work as a team, as a CNA. You work with others, the nurses, everybody sits down, analyze why the man is not okay. He said he doesn't want to take paracetamol. All right, let's see, can we give him Panadol? Is it because of the taste? I think Panadol will serve the same purpose, but it's not as bitter as paracetamol. So let's see. So it's something that the team has to work together. You cannot outrightly in the space that's in the feet of that moment and say, no, you're not supposed to take this. Give me this drug. You're not supposed to, or treat the person to feel less in that setting. So it is important that, like, I cannot overemphasize that everything a certified nurse assistant does must be under the supervision of a registered nurse. That's number one. So when you face any deadlock or anything that doesn't align with your duties, immediately reach out. Why? Because your job description does not cover that. There are certain things that your job description does not extend to. So even if within your job description you have any challenge, of course you should reach out to higher authorities, to the registered nurse. So that's the right thing to do. That's the right thing to do. I don't know if we can move on. Mr. Michael, you have something to say. If we keep answering, okay, Mr. Michael, ask your question. We are just going to run along and have what we have. Mr. Michael.
Hello, ma. Can you hear me?
Yes, yes, I can hear you, Mr. Michael. Yeah,
Oh
I can hear you, sir.
Me, please. Hello.
Yes, I can hear you. I can hear you. Go ahead, Mr. Michael. I'm hearing you. I'm with you. Okay.
Hello, ma. Can you hear me?
Yes, I can hear you. Yes, I can hear you. Go ahead.
I can.
Okay. So, Mr. Michael, maybe when you can hear me, I don't know, I can't hear you. Can't hear you. All right, so we want to look at ethical dilemmas that some CNAs face. So we want to look at balancing autonomy and beneficence. Balancing autonomy and beneficence. Michael cannot hear me, please. Can every other person hear me, please? So that I will know if my end is okay. Can every other person hear me, please?
Yes, we can hear you. Can hear you.
Just pray tomorrow's network will be better. Today, wow. Okay, so balancing
Hello, I think
autonomy.
I can.
Okay, go ahead. Mr. Michael, go ahead.
Okay, my question is, please, what about in a situation whereby your patient's decision making, like maybe the patient is deluded or is having issues with that capacity. So in that kind of situation, what can you do as a healthcare assistant? And you want to make sure
what you can do okay, Mr. Michael, I have lost you. Let me continue so we can move. Maybe when I get to you, you can ask the question. So I was saying that balancing autonomy and beneficence, that's number one. Now, ethical dilemma, sometimes respecting a patient's right to make their own decisions. Please, let's pay attention to this because this particular aspect will answer some of your questions that I've asked previously. But balancing autonomy, respecting the patient's right to make their own decisions, while also acting in the patient's best interest, particularly when the patient's choices may potentially harm their well-being. This is one of the dilemmas of a CNA. Remember that this particular one encompasses most of the questions you have asked. So let's be on the same page. Now, what do you do? Example, let's take for instance, a patient refuses to follow the recommended dietary guidelines, which could worsen their health condition. And the CNA, at this point, the CNA must balance the patient's autonomy. Remember that I said autonomy is very important, with the need to promote their overall health and safety. This is one of the things that we have been talking about, that we have been like emphasizing all along. That sometimes, even as a certified nurse assistant, you have issues with being able to balance certain things. You know, for you, you want the best for this person, the person that your patient wants this. What do you do? So, like an example that I've given to you, if you have a situation like that, you need to reach out to the team. Let everybody sit down and weigh options concerning how best can you handle that, how best can you work with it, how best can you work around that. You have to ensure that you relate with your interactions. Very, very important. You relate, you talk about the guideline, the food, you discuss the dietary preferences and what can be done in such situations. Very, very, very important, because you cannot, your client already has points. So you cannot at any point want to take away those rights from your clients. No, these are people that live their lives, that were able to make decisions for themselves. So all of a sudden, you want to be making decisions for them. No, but you can help them see how to, at the same time, balancing. It's just like someone says, oh, I don't like to drink, I don't like to take a coffee, maybe because coffee is bitter. I don't like to take coffee. And then you can, in a way of trying to balance the person's what the person wants, like the person's autonomy, fine. And you want the person to take Bonvita, but the person wants to take coffee. There is a way you can strike a balance. That's just what this is about. How you can strike a balance between the two. You sit down and talk. Okay, why do you really like Bonvita? Why do you really like it? Is it because of the person may say, oh, I like it because it is sweeter. Coffee is bitter. You say, okay. So when you sit down with the care team, you explain, because you have to report. Your client's preference is very, very important. You have to report. They have to weigh it and see, okay, if being bitter is the cause, this or that coffee is not good for him to take, or Bonvita is not for him to take. So you have to strike a balance and see how best you can align and ensure that you don't deprive your client of your autonomy at the same time not affecting the health of your client. So fine and good. Now let's look at this balancing autonomy and benefits, respecting the autonomy of your client and the right to make their own decisions, while also acting in their best interest to promote their overall health and safety. Now, what is the potential solution for that? The CNA should first try to understand the reasons behind the patient's refusal. Like I told you, that before any of such things, there is a reason. So let the CNA first try to understand the reasons behind the patient's refusal, engage in a calm and compassionate discussion, and explore alternative options that the patient may be more receptive to. Like I said, so when you sit with the team, there may be other options that the clients may be more receptive. That way, you are not totally taking away the autonomy from your patient. If the patient continues to refuse, then the CNA should consult with the healthcare team, like I already said, including the nurse and the physician, to determine the best course of action, which may involve the patient's family or legal guardian to assist with the decision-making process. So you see, there are processes for these things. There are processes for this thing. So that is practically it. And the CNA should thoroughly document the situation and the steps taken to address this ethical dilemma, ensuring that there is transparent communication in the decision making. So you see, that is number one. We are talking about dilemmas here, these things that you may likely face, situations that you may likely face, and what to do. This is very important in this training. Now, the next is confidentiality and privacy control.
Madam,
yes?
I don't want to be left out. There are scenarios actually in elderly patients where some of them are paralyzed. They cannot speak for themselves. There's that dilemma where they have people to speak for them. Maybe their family members, their legal team, or even the government.
That's what I'm saying. Yeah, yeah.
And then now there are those contradictions where the person standing to represent that patient contradicts with the patient's what? Autonomy. So how do you resolve such dilemma as a CNA?
Okay. As a CNA, it is not, to be very candid, it is not your duty to resolve the dilemma. As a CNA, as a certified nurse assistant, because when it gets to that particular stage, it's not for you, the CNA. Remember, I keep saying that the CNA, your duty is just maybe to do the reporting, and it is taken from there. Because in that situation, the legal team has to be involved. All the parties, the family, the patients, the healthcare team, everybody has to be involved in arriving at a decision, because we'll get to the legal aspect. That is legal, because there are times, like you said, most times the person that is supposed to be representing is at loggerheads, is on the opposite direction with the patient itself. They have different views. So there may be such issues. And when such issues arise, it is not for the CNA, it is not for the certified nurse assistant to handle. It is for the people in the higher hierarchy of the healthcare team to sit down and see how to go about it. And now the legal aspect, that has a legal connotation. So the legal aspect has to be brought into it when it comes to that. So we are actually looking at the extent a CNA can go. That's what a CNA can do to his or her level. For that, resolving that particular aspect is not the duty of either. Yeah. So I don't know if that's fine. So let's. Okay.
It's fine. It's fine.
So okay. So now I want us to, having said all the things that I have said at this point, I want us to quickly just look at some few practical questions. Let's just see. And these practical questions, I would like you to answer, because from your questions, I have discovered and I understand that we have very, very distinguished professionals here in this platform. So I would like you to answer from what we have talked about. So my first question, I don't know if we are together, because I want everyone to be involved in this. Please, are we together? I need to hear the response from everybody.
Yes, we are together.
Okay, thank you, Queen. Queen is the only one.
Yes, we are together.
Yes, we are
Okay, thank
together.
you.
Yes, we are here. We are here.
together.
All
Carry
right.
on, ma.
So let's look at the scenarios, because these are practicals. We have, I told you that all this one we are just saying today, A to Z, we are just looking at the surface. We are just talking. CNA is more of practicals. When you see the practical aspects, that's where we really delve into it. But you cannot take away the theory from the practical. So let's just look at it now. Sam is a CNA who notices that one of his patients, Mr. George, has been refusing to eat his meal. And then when Sam asks Mr. George about it, he explains that the food does not taste good to him. What should Sam do? Now that question is thrown open to the floor. What do you think Sam should do? Please, who is going to build the cat? Someone should give me a response to that question. I shouldn't be doing all the talking because I've talked.
Okay, all right.
Okay.
My name is
Your name is
Zoma.
Ujoma. Okay, Ujoma. Thank you.
Uzoma.
Okay,
So I
Uzoma.
yes, I think from the explanation you've been giving us, so I think as a satisfied CNA, I think what he should do is, first of all, find out why the food is not tasty to Mr. George. Then after finding out why, then he should be able to, convince him, then find out what is making the food not to be tasty. Then once that is done, what he needs to do again is he should find out, okay, which other food would you like to taste that you feel is good for you? Then if the food is out of his meal list as a CNA, I think what he should do is to report back to the nurse, the registered nurse he or she works under. Then they will now give him a feedback, okay, let's try this, let's try that. If it doesn't work out, maybe we'll just go with the one he wants. I hope I'm making sense, ma.
Wow, Uzoma, thank you. You have just answered the question. So I am glad that at least the network has actually made us really it has favored us a little to understand what I have said so far. So thank you. That's primarily the answer to that. First and foremost, what he needs to do, as I've said, Uzoma, is you have to advocate for Mr. George, by speaking with the dietary staff and requesting that they prepare Mr. John's and Mr. George's meal in a way that suits his preference. And before you do that, the best thing is you ask him, you find out from him, because obviously there is a reason. I don't want to eat this, I don't want to eat this, I don't want to eat this, because this. So there's always a reason. So when you know what the reason is, you can reach out to your in-charge nurse, and the best possible way would be to see how to prepare his meal in such a way that suits his preference. You understand? Explore other alternatives that are also healthy when they liaise with the team. See how best that you can prepare his meals for him to really like it and eat, because it shows professionalism in you advocating for the patient. Remember, you are the first hand to observe that he's not eating his food as a certified nurse assistant. So you have to ask him, find out from him, and then report to the nurse, and then see ways how it could be looked into, alternatives can be given to him to ensure that, yes, he continues to eat. So thank you, Uzoma. That's a beautiful response. Now, the next question for me, I would like a man to answer this one, if possible. If ask you for help administering the medication, even though it's not part of your authorized duties as a CNA, how should you respond? So what are we to do in such a situation? Please, can a man bail us out? A man, please. We don't want to waste so much time.
So how should you respond in such a scenario? You as a CNA, you need to create an environment that is going to actually make your patients understand. So how you're supposed to respond is you're supposed to tell that patient, you're supposed to create an environment. Of course, you tell him this drug is not authorized to be given to him, but you have to create that environment, that friendly environment between you and your patient. Yeah, that's what I think.
Wow, thank you so much. I think that's Mr. Because me, I'm taking note of people that are answering my questions so that I'll be happy. Those that are actually giving me joy, because I've not heard a couple of people talk on this platform. So who just responded, please, Mr.
Moaba.
Okay, Mr. Mala. I hope I'm correct. Okay, so thank you so much, sir. That's practically it.
So I want to ask.
Okay, please ask.
In respect to his response.
Okay.
Sorry, ma. Is it enough to just explain that you are actually not authorized to administer drug to me, or you are to, in addition to that, offer to call to report that to register or somebody who is authorized to help you with the drug?
Beautiful. Thank you. Thank you. Thank you, Patience. Thank you. So I don't know if that's Patience. Is it Patience talking? Hello.
Yes, ma'am.
Okay, please, who just responded now? Who just added that?
Oh, it's Patience.
Okay, so Patience, thank you so much for that. And
Patience, yes, network is bad. Yeah.
The gentleman that also responded. So this is practically, both of you are wonderful, wonderful responses, I must say. And I'm so happy to have this seasoned professionals on the platform. Now, this is exactly what you do. You can explain the patient that you are not allowed to administer medication, as that is outside of your scope as a certified nurse assistant. Explain. Then provide a courteous explanation that only licensed nurses or the patient or doctors can dispense medications. Then offer to assist the patient in contacting the appropriate healthcare provider who can help. So that is just it. So you see, you have taken care of all aspects. Let the person know, no, I cannot give you medications because it's not in my scope. But let me see how best I can help you. Let me refer you to, or let me get someone that is within the healthcare that is authorized to do that for you. So your answers are just wonderful. Thank you so much. Then we have the next one, and then the next one, number 3. A patient asks you to help him access their social media account on the facility computer. They want you to post a message on their behalf. How should you respond? Please, I need another person responding. Please. Just one. Maybe we'll leave the last question, then I just need a response to this one.
All right.
Who is going to build it?
My name is Uzoma.
Uzoma.
Yes, ma'am.
Heard your name and heard your name and heard your name. And I'm just wondering, what's going on? What's going on? Because we have about 31 people here, if not more. And I've not heard of us. Susan, I've not heard Susan. I've not heard Mr. Oliver, only at the beginning. Okay, but if there's no other person, please go ahead.
Okay, brings us to the role of a CNA in healthcare. So now, in the roles, we have to assist them. Now, in the process of assisting them, that means in the role of a CNA, it also leads us to the duties of a CNA. That's in terms of communication. If accessing the computer is a means of communicating with his family members, and I see it as maybe it's out of your duties to access the computer for them, I think you should report back to the registered nurses in charge. Then they'll give you a feedback. Okay, you're free to help them access their family through the gadgets available. Then I think it's okay. It's a good idea if we are asked to do that to support them in their duties. That's in terms of communicating effectively to the
Yeah. Thank you. Thank you so very much. Thank you for that beautiful response. Thank you. So practically, that is just the A to Z of it. So I'm glad that we are on the same page. Politely decline the patient's request as a CNA. You should not be accessing a patient's personal account or posting on their behalf, even if they ask you to. This would be a breach of explain that for privacy and security reasons, you are not able to assist, but suggest alternative ways that you can help, maybe by reaching out to the in-charge nurse, and then they could look for a way, if it's an urgent or important call, they can look for a way of handling that. So that being answered, let's just move. Really, we are just going to, we have some work to do, our time. I'm really scared because network has dealt with us and don't have too much of our time left. So having said that, that is just the A to Z of it. So do we have anything else? I want to quickly move so we delve into anatomy and physiology. Now, this is where the science students wear their caps, the science students and even the students that actually pass through secondary school begin to think of your biology classes as we move into this. Mr. Yelson, your hand is up. Pardon?
Yeah, I'd like to, in relation to the ethics and principles of a certified nursing assistant, we talk about being compassionate and all of that. So I feel some of these things are basic, unless it is a strict rule not to do. The social media, for instance, and then depending on the patient's health condition, I think plays a major role. If the person is mentally derailed, many things would have to be checked. But if the person is mentally upright, in relation to the social media, assuming the person has written something nice that you think you trying to show compassion is something, if you post for the person will feel happy. Or maybe the person that thing may even add up to easing the person's pain or stress. Don't you think that may not necessarily be as part of your work duty? But if you can do, if you have the skills to do that, is it good to assist the patient with that?
Really, sir.
Okay, thank you. What you have said is it's okay if I see it from your points, but it is important that I must emphasize that a CNA, you have your job description. Now, even if what the person wants to post on the social media would help the person get better, like you said, would have emotional, have a positive effect on the person, it is important for you to note that it is against your ethics. So you are not saying that you are only saying you would not do it because it doesn't lie within your duties to do it. But you are going to help by reaching out to appropriate authority to let them know. Because of course, if you reach out to your in-charge nurse in the higher level, they remember CNA is still on the grass, like we look at the grassroots, if I am permitted to use that word. So if what you can do is to help, if that's going to be of help, if it's an emergency or if it's for any major reason, you have offered your own help as the certified nurse assistant by raising that, by taking it up to your in-charge nurse, and then they'll follow it up from there. Because if it is important, no one is saying he or she doesn't have the right to do that. You are only saying that because we are looking at CNA duties. So you are just saying that it's not within your jurisdiction to do that. It's not in your job description to do that. So okay, because it will help. So there it's going to be out of your hands. Like we are not going to be involved if anything negative comes out of the picture. So that's just it. Not that you're not helping your clients, but it's just that it's not in your own jurisdiction to do that. It's not ethical for you to do that. That's just the truth. It doesn't fall in your hands to do that. So I guess that's fine. Is there any other one? Are we even together?
Yes, ma, I have.
Okay, Uzoma. Okay, let's ask. Today is going to be a sweet one because we have to do what we have to do. Go ahead, please, Uzoma.
My question is, as a CNA, and you
Okay.
have, let's say you're to help the patient get dressed in the morning, in the afternoon, or in the evening, then peradventure you see a bruise or a kind of injury on the patient. As a CNA, how would you exercise your virtue-based ethics?
Okay, fine. First and foremost, if you are taking care of your patients, like we said, I think we had something like that. There's bruise, you find bruises on your patient's body. Now, the first thing you need to do is, because of your ethics, your virtue-based ethics of showing compassion, of being of comfort, of empathy, first you try to find out what is actually keeping those bruises, what is causing those bruises on your clients, and on your patients. And then, having found out, in some situations, maybe the patient may not want to tell you, or the patient may want to tell you, whichever situation that plays out, it is in your duty, is under the consequences. It is in your duty to ensure that you report that particular incident and you document it. You let your senior know, your registered nurse, because I told you that there's hierarchy in the nursing. You cannot jump from your own and go to maybe the director. No, it has to be the nurse in charge. That's how they call it, the nurse that is in charge. So you have to report, oh, I was trying to tidy my client today. This is what I observed, either verbally or documented. You document it so that from there, now it will now be a cause for concern, because you are the first person to observe it, and because you are the closest person to the client and so the patient, so you were able to observe it fast, and then you reported it to your nurse, and then from there something will be done. So, but for your own, because of the connection you have with your clients, you have to express empathy. Like, oh, I've seen this on you. Oh, those bruises. How did it come about? And would you like to share? You don't invade your client's. I mean, you allow him to or her to actually tell you. So the bottom line of it all is that, like, go ahead. It is important that you connect with your patient. I've had situations where anybody that you don't have a level of connection with cannot open up to you when there are issues. That's what I want you to understand. Still, you maintain your professionalism, but there is how. It's just like us, like women can relate more to this. You have house help, maybe you can tell that out of the house help that you have, there's the one that you have this connection with, that you can easily say when something is wrong, and there's one that you cannot, you don't have that connection with. So everything is about relationship. It's about how you relate. When we get to communication, that's going to take a lot of time, because you will see communication skills on how you can communicate with your clients, how you can connect with them in such a way that it doesn't, all these problem challenges you would not have. It will make your CNA duties easier for you when you build that connection. So that is practically it. Yes, you can empathize with the person, ask what is the matter, whatever, but understand that you don't have power in your hand. So your power is mostly about reporting, observing, reporting, observing, and then from the higher hierarchy, they do what is necessary to do as registered nurses and maybe doctors and others as well. So, Uzoma, I guess.
Yes, ma. Thank you, ma.
Okay, you're welcome. So let's quickly, Hope's hand is raised. Hope, you said you wouldn't want to exceed 8 o'clock, and then you ask the question. So it's ironical. Okay, go ahead, Hope. It's nice to have you, because I've not heard your voice really. Go ahead.
Yes, thank you. I want to ask a question on, sometimes when you are assessing your patients and doing some things, and then there are some things they will tell you and they say it's confidential, you shouldn't report. So be a CNN. Is it right to go ahead?
Okay, now it depends on. Okay, I'm struggling to hear you, but I think I can just gather what you're trying to say. You say that maybe in the course of you being attending to a patient, there's some confidential information that maybe because of the connection, the person will tell you, and it's confidential. Like the person says, it's confidential. Am I correct?
But in the other way, you look at it that keeping it confidential might cause a that mean that there are other ways you can help than pushing it away?
Hope, I am struggling. I cannot hear you. I guess it's your network, but
Can you hear me now?
if I understand what you said, I can hear you fine. Go
You
ahead.
can hear me. Okay, what I'm saying, in a case after assessing your patient, and you discover there are some things patient discussed to you and said that it is confidential, you should not document it. But you keeping it confidential, you know that this is such a harm to your patient. Be a CNN, you still need to go ahead and document it, because documenting it is going to please benefit the patient. But looking at the patient as he said, don't document it.
Okay. Now, first and foremost, I want you to understand that as a certified nurse assistant, like we already said, your number one duty is to ensure that, your number one priority should be the well-being of your client. So it depends on what your client told you. That it's like someone saying, okay, you're attending to a patient, and the patient tells you, you know what, I'm just fed up of this. I'm going to commit suicide. I will just end it all. I'll just kill myself. I just want to die. For instance, now we are just using an illustration, and tells you, but this thing, I don't want you to tell anyone. I want it to be confidential. I don't want you to document it. What would you do? Let me throw the question back to you. I hope. What would you do? Would you document it, or you rather prefer to keep it confidential?
So me, that is not. Okay, for me,
Pardon?
if it's leading to suicidal ideation, I think I have
So that's, yes, you have answered the question. The question simply means that it depends on what your client is telling you that is confidential. If he is telling you something that is detrimental to his or her health, detrimental to health, detrimental to recovery, then it's not something that you should keep to yourself. It's something that you should document. It's something that you should reach out to your in charge registered nurse and report and tell. It is very, very important, because if it is detrimental to the health and for any reason it was known or knew about it before it actually happened or degenerated at that stage, then you have fallen short of one of your ethical, one of your ethics in the profession. So it depends. If the client just tells you, oh, I'm just going to, or my wife is just going to bring me a new car, I want you to keep it confidential, that's easy. You can keep it confidential. But anything that has got to do with the health or the well-being of your clients, you should report to appropriate quarters to your RN. So I guess that's okay. I don't know if that's okay, Hope. Can we ride on?
Yeah, thank you, ma. Thank you.
Okay. So other raised hands. Who are the other raised hands? Can we know who are the other raised hands? Because we have to complete anatomy and physiology. Please, does anyone else have a question? Saw some raised hands and I'm finding it difficult to see. Are we together?
Yes, ma, we are together.
Okay. Today is rather dull. I'm not really used to having such I know it's the weather and maybe the protest for tomorrow is really making people get into
Don't say protest. Anytime you say protest, the network will break more because they are tapping our phone.
This is okay, I'm not going to talk about it because of course, like Queen Madweke is on this platform. She's had a couple of trainings with me, introduction, dementia care and so on. She knows that on our trainings we used to be very lively, forward and backward like we used to. But today it's just not going that way. I don't know. I know network started wrongly anyway, but I won't talk about it. Cross my heart. Let's look at anatomy and physiology. Now, anatomy and physiology, if someone would ask why, it is very important that healthcare workers understand this, the human body, how the human body works. Now, because we are not registered nurses and we are not doctors, we are only just going to look at it on the surface. Like we're just going to look at it on the surface. So bring back your secondary school days, your science days, bring them back, because we are really going to delve into that for the next minutes that we have. Pardon me, like I said, obviously we are going to exceed 8 o'clock today, but I just plead with you that just today, after today, because you know what happened, network and the questions and everything, but from tomorrow we would adhere strictly to the time because it's not in our character. So that what it's important that certified nurse assistants are well grounded in anatomy and physiology, how the body works. Now, if you look at the body, you hold your hand, you wriggle it around, you take a sip of water, you sniff the air, you hold your breath, you walk, you do these things. They are so simple for you that you don't see. I'm sure we don't even give it a moment of thought. We don't even think about it, you know. We don't even bother as to how these things come about or how they. So it is important that we, as care workers, understand, because when we understand these things, it helps us understand when we see these patients behave the way they do. When we can easily tell when their conditions have worsened. You understand? So with this CNA, you have to have a little bit basic understanding of the human anatomy and physiology. So let's see. Now, the anatomy is simply the science of the structure of the body and relation to it, of its parts, how the parts of the body relate, how the skeletal system, the bones, how the intestine, how all the different parts of organs of the body, how they interrelate, how they work together to ensure that you are healthy. If something affects one part of your body, of course, it will affect your overall well-being. So these are things that certified nurse assistants have to understand, just the tip of it. So anatomy is simply the science of the structure of the body and relation of its parts, while physiology is the science of how those parts come together to function and keep the body alive. So you see, the two are together. Yes, we have the parts. How do those parts work together? How do they function together to actually make the body to come together? Now, every moment or every movement that you make, every new day that you live to see, is the result of a collection of systems working together to function properly. Your blood, your veins, your capillaries, your arteries, every part of your body, your bones, the skeletal system, the muscular system, all this work together to ensure that your body is built. Now, if your intestine is stretched, you know, like this, our intestine, if it is like stretched, it will be as long as a 3-story building. You will not believe all those intestines, those interconnected things in your intestine. If they were to maybe be removed and stretched all out, you see how long it is. So these are parts of the body that do different functions. That's practically what this is. Like you can see the human anatomy, you can see the liver, you can see the kidney, you can see the bones, you can see the sternum, you can see other parts. So practically the systems in the body are 12, like we have the systems in the body, 12 systems in the body. So what do these systems actually do? What do? They perform different functions in the body to ensure that we are to ensure that you are healthy, to ensure that you can move the part of your body as you wish very easily. You know, most times we don't even really understand the importance of these things. We just take them for granted because we know we can move the body. Oh, so people are having network. So God help us today. So, like I was saying, we have the circulatory system. We all know about that. The circulatory system. Our human body is a complex machine with various systems and parts that work. We have different systems and different parts that actually work. And these different parts all work together to do different things for us. So let's look at some of the systems, cross-section of them. The skeletal system, like we already know, is the frame of the body, just like the frame of a building. It provides support, it provides structure, it provides protection for your body. And this skeletal system comes in different shapes and sizes. You have the long bones, which is in your legs, the arms, how they help you to move. It also protects the vital organs. This is very important. We have the muscular system, which is like an engine, is responsible for movement, whether it is working, whether it is breathing or blinking, any movement at all. The muscles work. It helps us to move our bodies as we like. We have the circulatory system too, which is the blood highways, the body's highway, the body's transportation network. It carries oxygen, nutrients, other essential substances all through the body. The blood vessels, the arteries, the veins, the capillaries. We have the respiratory system as well that deals with the breathing, the lungs, the pumps that pump in air, the trachea, the bronchi, and so on. We have the digestive system too, that's about food. The body's kitchen, it breaks down the food that it eats. So all these organs practically talk about, like we have on this slide, they play different roles. Like I said, you would have the records, you have the slides to go back and study, because some people network, some people cannot really hear me, and so on. But as you have here, I took time to have the different systems in the body, you know, and what they do. So you take your time and look at them. It's just for you to have the knowledge, because of course you are working in the health system, in the health sector, and you are going to progress perhaps to be nurses, registered nurses, and so on and so forth. So you need this primary knowledge. So, but one last thing that is important is hemostasis. This is very, very important. It is a term that you as a certified nurse assistant cannot run away from. You cannot shy away from hemostasis. Very important. Now, our body is a way. This our body is this hemostasis, it's the way our body tries to maintain a stable balance. Different times, your body tries to maintain stable balance. Sometimes something will be happening, but your body is internally fighting against it. Fighting, you have it's a condition that maintains a stable your stable internal organs, everything in your body functioning properly. It has a way of maintaining balance. That is the A to Z of homeostasis. So let's say you are really, let me give you an example. Let's say you are on a really hot day, a day that is very, very hot, and your body temperature starts to rise. Your body doesn't want your temperature to get so high. Don't forget that you have to maintain a normal temperature, because if your body gets too high, if your temperature gets too high, it can be dangerous. So your body already has special mechanisms that will spring into action to bring your temperature down to a safe normal level. That is what we are talking about. Homeostasis is just an act of you having of the mechanisms you have in your body that will help you to fight, that will maintain the internal conditions regardless of what is happening outside. The internal condition, it struggles to ensure that everything is normal. For instance, also, let's look at the brain. Your brain signals you when it's a hot day, very hot day, and then your brain signals your sweat glands to produce sweat. Normal, when it is hot, your brain signals, before you know, you start sweating. As the sweat evaporates from your skin, it cools your body down. Your blood vessels will also dilate to allow blood to flow to the surface, to the skin surface, helping to dissipate the heat, helping to resolve the heat. So what am I trying to say? This is a particular condition. That's why when someone is not well, when you see that someone is not feeling fine or the person's immune system is attacked, it plays a role. It affects its homeostasis, because the ability, the mechanisms that your body have originally built to fight against certain things will be hampered. So it is important that as certified nurse assistants, we know how the body works. We know how the body can cushion certain effects. We know the mechanisms in the body that can actually handle certain illnesses or certain challenges. Even though we don't have to know it, we don't have to go into the details, all the medical jargons that are for doctors, are for nurses, but it is important that we have the basic knowledge. Hence, it is here. It's important for us to note when you see someone really get very ill, you understand what is the challenge, you understand what the person is passing through, and you understand the particular organ that is deficient, that is making it not to be possible for that person to get well or that particular condition to be handled immediately. So it's just about balance and stability. Your body, this body is constantly making tiny adjustments to keep everything in check, whether you like to believe it or not. Everything is in check, and to ensure that everything is running smoothly. So it is a vital process that helps us adapt and thrive in any situation, no matter how it is concerning our health. So this is very, very important. So now, as quickly as possible, I need to see those people. I can see that what is worth doing is actually worth doing well. So it is good if some people can just bear with me. I can assure you that in the next 15 minutes, we'll be done with this training. It isn't really my fault. The fault is that of network, and we had a couple of challenges. So if I say let's take this infection control till tomorrow, it would not it won't all go out well for us. So at this point, I would like to crave your indulgence, and I would like to ask, should we continue for the next 15 minutes? Are we still together?
Yes, ma'am, you can go ahead.
Go ahead.
Gone to sleep. It's like we have all gone to.
We are here. You can go ahead, please.
It's okay. It's fine, ma.
Yes, ma, you can go ahead.
Okay. Thank you. I'm only hearing two voices. I think some people cannot hear me. Please, can I go ahead?
We can hear you. Please go ahead.
We can hear you.
Okay.
We can hear you.
We can hear you loud and clear.
Okay.
Loud and
Thank you.
clear.
So, quickly, as fast as possible, we are going to look into infection control. As a CNA, I am sorry for the people that have left the platform, because they're just going to lose out of this. They're just going to lose out. Infection control is very important for a certified nurse assistant. Very, very important, because of the things you do. You do activities of daily living. And so you get to touch, you get to feel, you get to rub, and all those things. So you have to be on top of your game. Now, there is what we call this infection circle. Infection circle. And in this infection circle, like you can see, we have about 6 things here. We have the infectious agents, which is the host. So, the pathogen, I beg your pardon. The pathogen is either you call it infectious agents or you call it pathogen. We have pathogens around. We have bacteria, we have virus, we have fungi, we have parasites. Now, these are things that actually get into the body. Now, these are germs or microorganisms that can cause infection. They cause infection for us. So it is very important that as CNAs, we take this infection control very, very seriously and very important, because if we are not careful, it will affect our own health, and as well as because we deal with vulnerable people. So it can affect the people that we are actually taking care of. So we have the pathogens, like I said, which is the germs of the microorganisms that can cause the infection, like we already have here, the bacteria, the fungi, and so on. We also have the reservoir. The reservoir, that is where the infectious agent lives and multiplies. These bacteria, they live in people, they live in animals, they live in the soil, they live in food, they live in water, and they spread, they move. Spread the infection from him or her to another person. So we also have the portal of exit. How? What is the portal of exit? The coughing, the sneezing. Maybe you cough and you sneeze. That's the portal of exit. It comes out of your mouth. It comes out when you sneeze. And the body secretions too, and the feces, as well. So these are things that come out, portal of exit. They come out from our bodies. And then we have the mode of transmission. The mode of transmission could be through direct contact, where you have direct contact. It could be through indirect contact. It could be through vectors. We are going to look at it in the slides that follow. We are going to understand. Then portal of entry too. How do they enter? The mouth, the nose, the eyes, cuts in the skin, openings. That is very, very openings are portals of entry, where you have the nose, the mouth, and then that's how the infection spreads. So, for example, now let me give you an illustration while we move to the next slide. I told you it won't take more than 15 minutes. Now, the chain of infection. Now, for example, let's say someone has a flu, maybe in the facility where you work or in the hospital. Someone has a flu, a virus, which is the infectious agent. They cough and the virus particles get into the air. Now they cough without taking necessary precautions, without using their elbow to cough into, they just cough out and it gets into the air, which is the portal of exit. Now, someone else nearby breathes in those virus particles from the air. That's the mode of transmission. Breathe in that particular virus that is in the air. And if that person's immune system is not strong enough to fight off that flu virus, they can then become the new host and they get sick. That's why you see people in a confined space. Maybe some mothers, they have 3 or 4 children. When one gets ill, maybe sneezing or is having catarrh, the right thing for the parents to do to ensure that the other ones take medication, because they're in a confined space, and because as children, maybe they won't take notes, they won't be very particular about the tips for hygiene, like to cover, to sneeze, and all those things. They'll easily. So the best thing is to treat the others because it easily spreads. So that is practically what we are looking at. These are some pathogens. It can infect us and it can get into our systems. So just as you can see there, like germs from the hands, you can see the 2 fingers there, the 2 hands there. This one is clean, the other one is filled with germs. But when you look at it, you cannot see these germs with your naked eyes. That is why hygiene is very important. We'll get there to what to do. Now we have the reservoirs, like we talked about while I was saying, one of the chain of in the circle of infection. Now we have the reservoirs. They could be symptomatic, the ones that have the symptoms, and the ones that you see someone, you don't even know the person actually has those symptoms. Those ones are symptomatic. They don't have the symptoms. So symptomatic infections are more likely to be recognized. This means that the person, you will see it's something, maybe sneezing, coughing, you are able to see the symptoms. And such people, normal activities will normally be restricted, because of those symptoms. Then carriers do not display any signs or symptoms. That is where you see for those that actually have the symptoms of these infections, but they don't, it's not visible. You cannot see, they don't display the signs. You cannot really tell, maybe like someone having typhoid fever, you cannot tell a person is having typhoid fever at a glance. So as such, it's not the type that is easily, that we can easily see. So like I already explained these things, the portal of exit, the route which the pathogen can leave the reservoir. Like you can see that man opening his mouth so wide and then it comes out, comes out, and another person around the environment can get infected too. So you can see the portals of exit. You can see vomiting, diarrhea, sexual contact, respiratory, open wounds. These are some portals of exit. How? So now the mode of transmission, like from the pictures, you can see the vector, the insects can perch on this and then transfer to another person. Airborne diseases, airborne through the air, bloodborne through the blood, droplets, direct contact, like you can see there. So these are some ways that it could be transmitted. Then the portal of entry to inhalation via the respiratory tract, maybe you inhale, absorption through the eyes, maybe through the mucous membrane, such as the eyes. You have through the intestine, maybe if you ingest something that gets infectious, gastrointestinal tract, inoculation, insertion of medical devices, sometimes in a course of maybe carrying out a surgery or doing anything medically inclined, maybe you have to do a procedure. In the process, because you don't follow due process, you can introduce infection to another person. So the susceptible hosts, like we already said, especially when people are old and when people's immune system, health status is affected, it's they are very, very susceptible to such immune system not functioning properly, So these are some of the things that can make you to be a susceptible host to such things. So now, how can we break the chain of infection? That's what we want to look at now. How to break this chain of infection and stop infectious diseases? You can control or eliminate the agent as the source of transmission, protecting the portals of entry and host defenses. Now, what do we mean? Let's see. We talked about pathogens, virus, bacteria, parasite. What is that particular pathogen? Example, a patient with a bacterial infection like strep throat can be treated with antibiotics to clear the infection. Maybe someone has throat and you find out what is actually wrong. You check for what particular pathogen is involved. The next thing, when you go to the lab and have a lab test done, they'll give you antibiotics to take so that you can fight against that particular infection. You understand? And so if it's for a patient that doesn't have the symptom, it can be treated to clear the infection and prevent spread to others. Very important, because in a facility, as a healthcare worker, you deal with people. You deal with so many people around the clock, 24/7. So you cannot afford to be a carrier of anything, because it will spread like wildfire, because you move with vulnerable people, the sick, the injured, the ill. So you have to make sure that you are on top of your game. Wash your hands. Take all safety precautions. Use your PPE, which we'll get to that when we get to that module. Use your PPE. So also cooking food to safe temperatures. Some people don't even take note of how the temperature to cook food. When should you boil? How long should you boil your meats, your fresh, your poultry products? How long should you boil them? Some people take it for granted. They don't take note of these things, because it can easily spread infection. If you don't boil it like meat, there's a particular temperature you should boil your meat to. And if you don't, then you have yourself to blame, because you would not have killed the germs that are in it, and you can easily get infected, either you or your patient. So there are many ways that targeting the portal of entry can help. Now, how do you protect portals of entry? By using your PPE. Portal of entry, like your nose. If you use your nose mask, like you see that lady doing, you use your hand gloves. Hand gloves is your best friend as a CNA or a caregiver. Hand gloves, you shouldn't do away with it. Face shields too. When you are knowingly exposed to a pathogen, you know that your work relates to that, relates to you working with those people. Cover your nose, sneeze into your elbow, wash your hands regularly. Know the proper way. Like I said, that most of these things I'm just saying, we are going to see it in the practicals, the proper way to wash your hands properly, the proper way to wash your hands and keep it clean, the proper way to don and doff your hand gloves, the proper way what to do, how to remove your aprons, maybe your PPE, how to remove them to avoid spread of infection, and so on and so forth. Then practicing hand hygiene cannot be overemphasized. It's very important. Okay, so some school of thoughts feel that when you are able to maybe increase the host defense, maybe those vulnerable people, those people that are prone to being affected, if you can build their body immune system and help them to fight against this illnesses, it would be better. By maybe vaccination programs, help them to, when you take vaccination, you build the antibodies to help you target this thing when they actually come. Then we also have what we call herd immunity. It simply talks about you helping a large percentage of individuals in a particular population when they are resistant to a particular pathogen. Maybe they've taken their immunizations, they have all it takes to be able to resist. Fine, if they are able to resist and protect themselves, then it is easier, because you have few people that will spread the infection. If you have just few that have the poor immune system that cannot handle it, and you have like many of them that are already resistant, that they are already prepared, they are already able to fight the pathogens, it would help, because it will reduce the spread from one person to another. It will reduce the spread of this infection. So these are things that are practically very, very important tips that we need to know. Proper hand washing, hygiene. Use leak-proof bags for soiled linens. Disinfect surfaces, that cannot be overemphasized. Clean counters, wheelchairs, anything you touch, ensure that you disinfect. Wear your PPE when necessary, anytime. Don't joke with that. Always protect yourself, because you need to stay safe to be able to handle your patients. Prevent dust and particle movement. Never shake linens. Yes, that's another thing. Don't just carry bed sheet and dust and shake. No, that's not the proper way. We are going to see it when we do the practicals. You don't dust particles, you don't dust materials like that, because because they can spread infection. Then flush urine and feces in toilet. Rinse well and spray with disinfectant. Hand hygiene, this cannot be overemphasized, like I already said. Wash your hands, and wash your hands. Use soap, use alcohol-based rub. At all times, without proper hand hygiene, your hands quickly spread germs. The fastest way of spreading infection is through the hand, I must tell you, because most of the things we do, nearly everything we do with our hands. So about 90% people die from these infections every year, according to disease control, Center for Disease Control. So many people die as a result of this infection. So when are we supposed to wash our hands? You clean your hands at the following times: upon arriving at work, when entering a residence room or in the hospital. Before putting on your gloves, wash your hands. Removing your gloves, wash your hands. When you remove your gloves, wash your hands. When you are leaving the residence, wash your hands. When you are feeding or before you feed and after feeding, these are things after using the bathroom, and so on and so forth. So practically, that is the A to Z of what we actually have for today. Like I told you, that we wouldn't exceed a particular time. So having said that, I must tell you, and I still repeat that, never mind if you did not understand anything, I pray network will favor us on the days of our practicals. We are going to have most of these things practicalized. Like I said, our CNA is all about practicals. We are going to see how we can wash our hands properly, how we can don and doff gloves properly to avoid spread of infection, how we can use our PPE, how we can do a whole lot of work. They are going to see it, how we can give a patient bed bath, how we can do a whole lot of things. So at this point, we have come to the end of today's training, but I would like to, at this point, I would like to ask if there's any question. Now, like I said, when we started, network really obstructed us, so I really apologize for this taking of your time. Normally, I keep time. Then secondly, what I want to say is, the group, the essence for that participant group, registered participant group, is so that all the people, all the registered participants can actually communicate. Like, I always respond there. So if in the course of this training, one or two things that you cannot ask or you've not asked, please kindly drop it for me. I'll ensure I answer and take everybody's questions. I like to do that, carry everyone along. Today, I've not really had time to call everybody's name and everyone, but I trust tomorrow will be a better day for us. I trust tomorrow will be better with network on God being on our side. So if there's any question or anything you would like to know at this point, please just ask before I hand over to MJB Management and Integrated Services. But I would like to, like what I like to do, I'd like to hear maybe one or two responses, one from a man, one from a woman, telling me what has really stood out for you today, or what you have learned, just a sentence, a big deal, just to make me happy and maybe get more energy for tomorrow's training. Thank you. So the floor is open now for everyone.
Hello.
Hi, please go ahead, sir.
Yes. Thank you very much, Ma, for your lectures today. God bless you.
Bless you too. Thank you.
Yeah. This is Isaac from Liberia.
Okay, Mr. Isaac, go ahead, please, Mr. Isaac. Mr. Isaac Ba, I hope I'm correct, your surname.
All right, Ma. Yes, there is something I want to. If I could get you properly as a CNA, your major duty is to assess, observe, and report, right?
Beautiful, yes.
Okay, thank you. That's what I want to understand.
Yes, that is your core duties. Your core duties does not include surgical, maybe operations, doing the risky jobs like dealing with directly with human blood and all those things. No, your own duty is primarily observation, comforting your client, and making sure the environment is clean, and also learning from the registered nurse, assisting to do maybe get me this, and then so on. You cannot make any decision on your own. You report directly to the registered nurse, and you are supervised by the registered nurse. Thank you.
Okay. it's like before you comment on anything, you have to ask permission
Correct.
from a
Within your
registered
duties.
or
Yes.
or your
Yes. Right.
yes.
That's right. You are
All
right.
right.
Anything, especially anything I said that
Come on,
is in a dilemma situation, you have to really report. You don't have, like, you are like a junior staff when it comes to the hierarchy. So you cannot be answerable for any major thing. When they come, is the registered nurse that will ask. Nobody will come and ask you why the person do this. So it is the registered nurse that will ask. So you report directly to her, and she supervises you in the course of your duties. So that is it. Yes, sir. Any other questions?
Thank you.
Thank you so much, Mr. Isaac.
Madam.
Yes, sir.
You're speaking to Mwawa. Another question goes to the second, when you just started the second slide, which says primary, secondary, and tertiary. Now, because the CNA is based on actually primary and this hierarchy, you follow the hierarchy, you report to a registered nurse.
That's correct.
Now,
yes,
in
correct.
scenario where you like in a hospital setting, primarily you have nurses, we have doctors and whatnot.
Yeah.
Yeah, you can work. Now we jump to secondary where you have specialists. In a case where maybe a theater, let's say, where there is rather the registered nurse, can a CNA work there, or is that limited on a primary level?
Okay. Now, your question is how I'm going to answer it in two ways. Now, there is how, if it is if it's a serious emergency in a theater, a certified nurse assistant can actually be there, but you cannot perform any duty. Cannot perform any duty. In fact, it depends on the policy. Depends on the party in the organization or where you are working, in the facility that you are working, or in the hospital. There are some hospitals that will actually permit a certified nurse assistant when they are having maybe surgery, or maybe those in the theater. Yes, why? So that they can tell you, get me this, get me that. Maybe, oh, I just need this. Can you reach out, bring that case? I need to get my I need to get this, or I need to get that. Those are your duties. You cannot perform any hands-on duty when it comes to surgery. That is in some settings, different countries, different organizations, their policies. But in some settings, certified nurse assistants are not permitted to be in the surgical, as in where they are having surgery, or where they are having very serious operations, or maybe there. You understand? So it depends. That's why I answered in two ways. It depends on the facility that you are. Fine, yes, in one part, you can be permitted to go in there. Why? So that you see what is going on there. You can learn, just like maybe a student nurse. You get to see what is happening. Yes, but you cannot perform any hands-on thing. You cannot do anything. You cannot even be told, hold the leg or hold the hand. No, all you are doing there just to see, maybe reach out for this, get me that case, do this and do that. That's all. The registered nurse and maybe the doctors and the specialists are the ones that actually perform the actual act. Why? Because it is assumed that as a CNA, which is correct, you don't have that advanced knowledge to be able to do any of those tasks. Remember, I said that you don't have. So it will take more education, the license, and other procedures, regulated procedures, before you can maybe attain the height of a registered nurse where you can do all those things. But primarily, as a certified nurse assistant, your primary duty is not to be in the theater. You may just be there, maybe learn one or two things for learning purposes, if that particular facility permits you. So I don't know, sir, if that's okay, if you understand.
Yes, well understood.
Okay, so do we have any other question? I need to hear from a lady before I hand over to MJB. Just the men that have.
Yes, ma. Yes,
So,
ma.
I have a question. I do have a question.
All right, go ahead and ask your question.
Okay. So it's like we are jamming.
Okay, who is actually asking first?
My name is Patience.
Okay, Patience asked, and the other person would ask. Thank you, Patience.
Okay, so my question is really taking us back a bit. So for some courses, usually for certification, there's an amount of hour or something like that that is normally required for you to be certified. Does that apply to CNA? Is there a number of hours that needs to go into this course, alongside both the learning and the practical, for us to be certified?
Okay, that's a beautiful question. Now, still, I would still like to say, when it comes to the nursing, like for the nursing profession, there are hours. They give you a specific number of hours that you have to learn. For us, for CNAs, there is absolutely no restriction as to that. Like there's no emphasis on that. There's no emphasis on the number of hours. So long as, like for BCC UK, let me speak for BCC UK, for us, on your transcripts will be there, the duration. Is either they take hours or duration. Those are the two things that they look at. So if you have a duration of maybe say 1 month, like we are having a duration of 1 month, so on your certificate, on rather not certificate, but transcript, on your transcript you are going to collect, it's going to be given a duration of 1 month, which is perfectly acceptable. If it is hours, some people do the hours, but it's not cast on concrete, like there's no fixed hour. Most important thing is for you to have the right knowledge and for you to have been certified as a nursing assistant. That is what they actually look out for. But when it comes to nursing profession properly, and maybe, the nursing profession, that's when they really streamline. And it's not in all areas. Some talk about the duration. So the duration serves the same purpose as the number of hours, wherever and whenever the need arises to talk about it. So I don't know if that's okay, ma'am. Is that
Hello,
fine?
please.
Yes, please. Yes.
Okay.
Hello, can you hear me?
Yes, I can hear you.
Okay, this is Oliver. Oliver, my phone just went down, so I'm using my husband as
Okay,
question.
Mr. Oliver, is here? Is
Okay,
Esther
please.
here?
Okay, what I learned from this class is that an ACA is a support worker because you
A
work
CNA.
under CNA.
Correct.
Because
Yes.
you are working under the supervision of a
the
registered
registered
nurse.
Yes,
Okay.
correct. Mhm.
Okay, and when we were dealing on the rules of a CNA, you said that one of the rules is to maintain a clean and a hygiene environment. That because like in a hospital setting, we have nurses, we have different categories of staffs. We have cleaners.
Of course. Yeah.
So is it a duty of a CNA to make sure the environment is clean? That's what I want to ask now.
Okay, thank you. What I meant by, I know you must have seen me say, ensure that your patient's environment is clean. Maybe that's why this question is. Now, a certified nurse assistant is not a cleaner. It's not a capital. You're a certified nurse assistant is not a cleaner. But at the same time, a certified nurse assistant, one of your primary, as in one of your, in your ethics or whatever, I don't know, your paramount duty is to ensure that anything that will make your client comfortable, you should do it. Okay. It is not your duty to mop. For instance, let me give you an example. Maybe in the course of you doing your work, there's water spilled on the floor, and the cleaner, you reach out for the cleaner, maybe the cleaner is not forthcoming. You wouldn't say because you are not a cleaner, or but because you know that that's water, maybe someone can slip and fall, or your client can be injured. It doesn't take anything to step into the shoes and a certified nurse assistant is not a cleaner. You know why I'm saying so? Because if you're in charge, walks into the ward and then sees water around you, and you are there as a certified nurse assistant, there will be a question mark, because automatically she will say, why didn't the cleaner clean this? And that is a raised eyebrow, because if the cleaner is not readily available, because your client is of paramount interest here, and your safety is very important in a hospital setting. So that someone does not slip and fall, you can easily step up and clean, but you are not a cleaner. A certified nurse assistant is absolutely not a cleaner.
Okay, thank you, ma. Thank you, ma. I enjoyed your class. Thank you.
You're welcome. So,
All
any
right,
other
Mama.
question?
Mama.
Okay. We are really going to. Yeah, go ahead. Who is asking the question?
I have a question.
Okay, tell us your name so we can just know you.
Okay, Mabolanda Bidemi.
Pardon?
Bidemi.
Okay, Bidemi. Bidemi. Okay. Okay, Bidemi.
Actually, I want to ask if nursing program can also be the course can also be taken online like this. Can also be online like this. And additionally, I want to know if taking the course online, you can practice it somewhere. We can apply to a hospital to practice what you have just learned online. Is it possible?
Okay. There are two things involved. Like, I'm going to answer your question in two ways.
Okay.
First and foremost, it's not very common to have the nursing course, like the nurses, the registered nurse. It's not very common to have it practiced online. But because of technology, you can practice, a nurse can practice, can have the training online. You can have the training online, but after having the training online, you have to make sure that the training encompasses the practical aspect, because like anything pertaining to nursing, pertaining to caregiving, pertaining to maybe certified nurse, health, whatever, all those courses are courses that you deal with human life. So you have to really learn practical aspects of it. But many people feel that when you run a training online, they feel that, I need to be there to see you physically. I need to do this and do that. Yes. But the fact is that anybody that is not willing to move, find out that the world is going to move past that as it is now. Technology has made it easier. You can learn anything anywhere. But again, I must also let you know that registered nursing has many, I don't know how to explain it. Registered nursing is more regulated. Is more regulated than CNA is more regulated. They have their body, they have their there are a lot of regulations. So it can be, even though BCC UK, we do not do nursing programs. We don't. But there are other online trainers that do that. We don't do the nursing proper. Okay. Maybe subsequently we can do that in future, but for now we do the CNA. But you can do it online. That's okay. But another thing I wanted to say is that some of you expressed we're trying to talk about recommendation and so on and so forth. It's also important, like we are going to have the practicals, we're going to have a hands-on on how to do some of these skills. You will actually do the skills, and you get it back to us for us to see how best they're able to do the skills. So for this particular program, be rest assured that we are leaving no stone unturned to ensure that everything you need to know as a CNA, you will not fall short of it. Because like I told you, most of you, when you eventually get jobs, they actually reach out to us. Previously, all the sets that we have had, when it comes to maybe visa application, when it comes to maybe the employers, taking you maybe in Nigeria or anywhere you may wish to practice, they actually reach back to BCC UK. That's what they do. They send us, and we have to attest the fact they actually pass through us, because you know how these things work. There are stringent measures depending on the countries that are involved. So it's actually done online, because there's basically no course that cannot be done online with this era of technology. But the nursing is more regulated and it's more tight, if I want to use that, than just the CNA, because the CNA is the first level, because they don't really deal with human life, blood and all these things, surgery and all this. But when it gets to that point, it gets very regulated, and it doesn't just go very easy like that. So I don't know if that's okay for you. Do we have any other questions?
Yes, I have a question.
Ma, please. Hello, ma.
Yes, I'm hearing your name, please.
My hands are raised up. My hands are raised.
Okay, my name is
please.
Patience. Okay.
Patience. Okay. Patience. Patience, yes. Hello, Patience. I'm waiting for you. We don't have all day.
Please let me
Okay, who
come.
was in?
Yeah, Mabel.
Okay, Mabel, please go ahead. Mabel, ask your question,
I
please.
have just 2 short questions to ask. The first one
Okay.
is, I don't know about the written materials. Is there provision for it?
Yes, very well. Very well. Very well. Is there provision for, let me get it clearly, is there provision for written materials? I don't understand.
Are
Hello,
you
Mabel.
throwing the question back?
No,
Okay.
I'm
Yeah, I
asking
want
if
to know because I can see, yeah. Okay, you're asking for me.
wanted to know. I
This is
can't
my
hear you very
question.
clearly.
Can you hear me now? Can
Okay.
you hear me?
Yes, Mabel, go
Can you?
ahead. I'm hearing you. Yes.
Yeah, I want to know if there are written materials on ground for this course.
Of course, very well. Very, very correct. Very well. You will have a slide as well as a recording of this particular training from the beginning up until the last day we finish.
Okay, thank you.
Yeah,
That's
you
number
will
one
have.
question. But 2
Okay.
question is, can somebody join us after today?
Who is asking this? Mabel, is it you?
Mabel is talking.
Okay,
I said I
Mabel.
have 2 questions.
Yes, I've
Join
answered
us.
the first question. Second, you said, can someone join me after now? Okay, I think that is we can talk about that. I think we should just get into my DM later. We'll talk about that. I'll explain that to you. All right. Thank you. Any other questions from anyone?
Yes, I have a question. Good evening, ma.
Good evening. Go ahead.
Okay, at
Good
the
evening.
earlier.
That voice.
Okay, my name is Esther.
Okay, Esther, go ahead.
Okay, at the beginning of the class, I think I had a network challenge. So I don't know if that's yes, please.
Okay,
My question now.
At the beginning of the class, I had network challenge. I don't know if this was addressed. I want to know if this certified nurse assistant can form a basis for further study, like nursing, going into nursing fully. And if yes, since we don't have like a science background, like the physics, the chemistry, and all that, is it still possible to build a career in it?
Okay, okay, thank you. Thank you, Esther. Now, someone had asked that question anyway, but I want to tell you, like I told the person, that when, as a CNA, certified nurse assistant, remember when we were actually accepting applications for this training, we said that anybody lower than a YA holder, we wouldn't want it. So it's assumed that for CNA, the background knowledge of a science, like you learned in school, your science, basic science, or biology at least, would be able to help you. So if you are a certified nurse assistant, of course, yes, a very big yes. You can further, like I said earlier, I think maybe network will allow you, you can further and progress in the nursing hierarchy. That is very, very correct. In fact, you have an edge over someone that is just maybe from the secondary school and moving straight to be maybe have BSc in nursing. You know, you have an edge because you already have the knowledge, the background, the basic, yes, that's the word, the basic knowledge of how to go about. So with that, it's very easy. It doesn't affect you if you are not science inclined, because you know we learn from your secondary school, you have your CNA, for instance. Now you have learned what you need to learn. So all you have to do is to move higher, maybe acquire other certifications in the health related sector, maybe in the nursing hierarchy, BSc in nursing, or maybe to progress higher. So it's a qualification that stands you out when you want to move higher in the nursing hierarchy. So that's it. I don't know if I've
Thank you so much. Thank you. I really appreciate it. And I enjoy your class. Thank you.
Thank you too. You're welcome. Any other question?
Yes, ma. My name is Uzoma.
Okay, Uzoma, thank you, Uzoma. I've not heard from people since, and I'm really going to fish them out from tomorrow because people's names that are strange in my ear. I've not heard their voices. So go ahead, Uzoma. Go ahead and ask your question.
My question is, I just wanted you to throw more light on this homeostatic, because you earlier on said it happens automatically. You said it happens automatically. It is a way the body maintains a critical functions
Balance.
it needs
Yes,
to operate properly and keep you healthy, no matter what changes around you. So I just wanted you to throw more light. Hello, ma'am.
Okay. I'm hearing you. I couldn't hear you initially. Now, I want to give you an illustration. Now, right now, so that you understand the hemostasis I talked about. Now, for instance, you have a fridge in your house. I guess you have a refrigerator in your house. Sometimes you get to hear a cushioning effect, like a thermostat. I don't know if you understand a cushioning effect. When the temperature goes very, very high, you hear a sound. It has regulated the temperature of that fridge. So what am I trying to say? That is just the layman's understanding of that hemostasis. It is the way the body is able to cushion effects of certain things. For instance, now if there is cold, automatically you begin to shiver. But because of your internal conditions, because of the controls in your body, it has a way of helping you to cushion that effect. It helps you build that, regularize. It's just like you have what do they call this appliance used with television to stabilize, a stabilizer. Thank you. A stabilizer. So that is just how it is. It stabilizes your body conditions. It stabilizes your blood pressure. It stabilizes a whole thing. It's body mechanism that is already implanted. People, maybe if it's blood sugar, when you eat food, your blood sugar rises, but your body has hormones like insulin that help you to regulate that sugar. They signal your cells to absorb the excess sugar, bringing your levels back to a normal range. So that is what hemostasis simply means. I don't know if you understood what I said from the illustrations. Everybody has that effect in body. So it just works when it needs to. It maintains a balance, it maintains a stability. But when people are critically ill, it becomes a problem that those stability, they are shaken.
Hello?
So that's
It's come out.
So that's just it, my dear. I don't know if that's good for you.
Yes, ma'am.
So any other question before I hand over to MJB management? And one other raised hand. Do we have any other person?
My
Mabel,
last question,
I see your hand.
patience question.
Okay.
Oh.
Mabel,
Patience.
Okay, patience. So
Thank you, ma. So my question is, thank you, ma, for the very, wonderful section today. It's really
You're
very
welcome.
exciting,
You're
to
welcome.
hear, and I really like the way you are detailed and give us all the opportunity to ask our question. But I want
You're
to
welcome.
quickly ask, as you are training, we need idea on what the exam will look like so that we are following you in that light at the back of our mind. Is it going to be an objective, subjective theory, or what is the nature, so that is it kind of going to be like the kind of question we did after at the end of the other section? What will it look like so that we are following in that light too?
Okay, Patience. I was just, what made me laugh? I was just thinking, I said, but when you continue speaking, I knew that was not what you wanted. I was just thinking maybe you wanted me to give you a little bit of expo, those things we used to do in those days when we were in school. But when you continue talking, I knew that was not what you wanted. Okay.
Yeah, that's not what I wanted.
I know that's not what you wanted. Our questions, the normal questions, you are going to have multi-choice questions. And you are going to have a couple of practicals, hands-on practicals that you'll have to let us assess, maybe one skill or two, to know whether you actually can perform it well. So it's a mixture of the computer-based test. It's going to be multi-choice questions for you. It's just something that you are given a particular time. You are given the questions A, B, C. You circle the correct one and move. The system automatically gives you your score. From BCC UK, they don't do it here. So it just gives you your score at the end of the day. And then you will have to do the practicals, maybe 1 or 2 skills, whichever one, either maybe to doff and don gloves. You have to show us, have a short clip of it, and then we'll assess you based on that, give you your cumulative score. So that's just, I want to assure you that it's not a difficult thing. We've been training for some years now. We've been training CNAs, and we've not had anybody really fail. But if anybody that performs below, it's actually over 500, the max is over 500, everything. So anybody that scores maybe below 350, you'll be advised to retake the exams. So that's just how it is. But so far, so good. We've not had, because if you score less than 350, it means that we cannot attest for you from any employer when the need arises. So you just be advised to retake the test. But that's just it. It's always easy. Be rest assured, and I assure you of that.
Thank you very much.
You're welcome. So I think on that note, we don't have any other question, because we just have to call it a day. Mabel, your hand is still raised. So I don't know if it was the past hand or the present hand. But however, having heard everything you have said,
I think it's the past hand. My hands are not raised. Hello? 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 Can
Yeah.
anyone hear me?
Yes, ma'am.
Yeah, my hands are not raised, so sorry. I think
Okay.
it's the past one.
My hand is raised. So.
Okay, somebody's hands is raised.
so okay, so on MKB management, on that note, I think we hand over to you. Hello?
Yes, ma'am.
There is a hand, though. Doctor, there is a hand. I think Mr. Hyson's hand. No, Mr. Hyson's, his hand is up.
Mr. Hysens, sorry, please. Network took me off and I had to reconnect again. Sorry, please. Go ahead, Mr. Hysens.
Okay, the name is Kennedy, actually. But you see Hyson.
Okay, Mr. Kennedy, it's nice to hear your voice. So I've only been chatting and I've never heard your voice. Even when I want to do voice call, I don't even hear your voice. So it's nice to hear your voice now. Thank you. Go ahead, sir.
I appreciate the lecture. It was quite informative. Just mine is just a contribution and observation, so that probably for the benefit of, I think I already dropped it on the group chat already. I think we should try as much as possible to stick to the timing. Some of us have other online engagements that will start at some, so or get the that and
okay.
So
I succumb. Yeah, if not, the question will keep coming till next year. Let's just
okay. Thank you
Yeah.
so much, Mr. Hysen. Thank you for that. First and foremost, we did have network issue. Don't forget that too, that we're struggling at the beginning over how many minutes, but nevertheless, it's not in our character to do that, to extend the time. I really appreciate your patience. From tomorrow, it is noted. We would adhere to that. Thank you so much.
All right, thank you. I appreciate it.
So MJB, over to you, please.
All right, thank you. Thank you so much, Doctor. Thank you everyone for staying with us. We are sorry about the time. It was due to network and other things, but now we'll try our possible best. All questions will come at the end of the lesson or at the end of the lecture such that it doesn't hold us back. We really appreciate the time. Doctor, thank you so much. Our participants, thank you so much for a wonderful first day. Hope to see us tomorrow. Do have a lovely night rest. Bye for now.
Bye-bye.
Bye-bye. Good night, all.
Everybody, good night, everybody.
Thank you, sir.